Megan Fox has the story.
Megan Fox.
Megan Fox.
Megan Fox.
Megan Fox. Megan Fox, a national journalist.
Mastodon. I will never be able to say that out loud.
It feels like the Flintstones live there.
It does.
Well, don't trust women. I think you just touched on that with your last. That's what they brought. We're going to have to bring back chaperones.
Jesus, no.
Just careful, Carol. Stop! Right. Ooh. Hard right.
How did you screw up a stove, Megan? You're a woman. I thought that was baked into you, like at the genetic level, how to operate kitchen equipment.
And honestly, Megan, if you don't like it, I'm sorry. I've been very nice to you.
You get Dino hanging out outside chewing on a large bone. I highly recommend being targeted by the New York Times and Rolling Stone for weight loss. And I'd say, keep it coming. I need to lose 20 more. Please, keep it coming.
Explain to me, Megan, why did this country not have a holiday once a year? That's the time you vote. If you don't show up and vote, up your ass. You don't get another chance. You don't get, I don't care if you're in the hospital. Crawl to the stake, crawl there. But that's it. One day, 12 hours, and then you're done. And you count them that day, and that night you know who the hell won.
I will eat you alive. You want to tangle? You want to go?
The only thing going through my head is, what are you going to do when Megan Fox runs wild on you, brother?
He made a deal with the devil. She's the devil.
He wants that.
Oh, God. Gross! Oh! All right. Penalty box for slug. Yep.
Of a mile.
Are you ready to behave yourself now, slug?
This frustrating rep.
Are you ready to behave yourself? Repossessed puppies. I'm hiding pork chop. ASAP. Have you seen his little pork chop? Oh my God, pork chop is the cutest.
That sounds bad.
Have you seen it?
Pork. It's pork.
Though you may be tempted, do not contact any person or persons mentioned on this stream. Do not even think about contacting anyone who may be the topic of the daily news. If you should do that, the host will question your IQ, possibly call you names, and mock you for disobeying these basic rules of decency.
All the best! All the best! Good morning or afternoon or evening or wherever you are. We're back. Sorry that we're late today. I forgot that I had a neurologist appointment this morning with my daughter. So that's a really long way away and it's like an hour drive. It's a whole thing. But we got it worked out where we're still going to be able to do this today before Flux has to take a day off tomorrow. And I probably will too. Like I said, I'm going to do Laura Owens updates tomorrow, I think. All right. So Jennifer Williams is here from You're the Power. House of Flux is in the house. And I think we're short a couple of ladies today, but that's okay. We'll be all right. I'm actually going to send Brad an invite, see if Brad wants to come since it is close to his lunchtime. Maybe he has a chance to drop in here. Actually, I'm going to text him. Want to stream? All right. So we have the bingo card, and the bingo card is hilarious as usual. It is pinned to the top of the chat. If you want to play with us, you have to click on that and click generate card, and we'll go over a couple of things that are on the card today. Let's see, where did I put it? Oh, here we go. That's the one I want. Okay. Share screen. What's wrong with me? Why can't I get this? There we go. Free bingo card. There it is. All right. All right. Here are the squares that you may have on your card today. And Flux just reminded me that you could play more than one card at once. If you wanted to open a couple of browser windows, you can actually play 2 or 3 at once, or as many as you can open at once.
As many as you want.
Yeah. Yeah, and since today it's getting so much more difficult, you might need more than one. So excuse my voice. I know I still sound sick. I'm going to try not to. I just burned my mouth on my tea, by the way. I had been drinking tea, but I forgot that I just filled it up with boiling water, and I went and took a big gulp, and I burned the hell out of my tongue. So yeah, nice. So we got dumpster moment, hair talk. What do you do here? State lies, evasive answers, didn't do nothing. Meg's blood pressure meds stopped working, conflicting testimony, drunk or high witness, Megan snorts. The simulation does not disappoint. River dancing, free space, which you can check off now. Sidebar, Flux hates prosecutor. Appropriate, loving parents. What a bitch. Judge has a Werther's break. Fake words. Blink rate anomaly. Defensive body language. The C word. Get squunched. Sex scandal face. Spider-Man meme. And then we have the alternate squares, thug judge, Megan hates prosecutor, overruled, sustained, lazy investigator, Flux is gonna get angry, muted boomer, bird talk, invade Canada, they're making shit up, Megan hits the wrong button, witch citing perjury, unknown significance, osteogenesis imperfecta. I'm never gonna be able to say it the right way again, by the way. Bendy babies, AI portion of the show, weird mouth noises, Flux pets cat, and no, that is not a euphemism. Carrie's dad's smoker's cough. Flux chooses violence. For fuck's sake, unfucking real. What if anything? Awkward pause, annoying hand gestures, and baby stealer. Okay.
Yes.
Man, this is the most epic bingo card we've ever had. Honest to God, ever. This is so crazy. All right, how do I get to it is the question, because I need to generate mine now. Where the hell did it go? Why did it get rid of my other one? If I hit save, is it going to screw up the card? God, I hope not. I hope it didn't screw up the card.
Should be
all
good.
Right, I have mine now. This is mine. This is the one I have. I hope it didn't screw up anybody's card that I hit save. Okay. Let's go back to Stephen Messner. This flaming weirdo baby stealer. Go ahead and check baby stealer off your bingo card. Please.
Oh, damn.
Baby stealer. Do I have it? I don't have it either. Dang it.
You do have it. It's right there.
Wait, I do?
Second from the bottom.
You're right. I do have it. Awesome. Okay. All right. We're going to share this. Here we go. This is the perfect screen grab. Look at the pause face. Tongue out, sticking his tongue out at justice. This guy, Stephen Messner, he is a CHOA's child abuse pediatrician. And yesterday we learned that he didn't read anything or do any investigation other than to read Dr. Brown's report. We also learned that he thinks he's a geneticist. He thinks he's a pathologist. He thinks that he is a radiologist, and he is none of those things. Oh, Flux is petting the cat. Yep.
She's cuddling early today.
Yeah, that happened early, man. I don't have that on my card.
Oh, and she's already gone. So we got it early today.
Awesome. All right. I have to Flux pets cat. I have to write down the ones that I don't have on my card. All right. We are starting with Catherine Bernard's cross-examination of this guy. He's a real twat, by the way. Can I say twat before 2 hours into a live stream? I hope so. Oh, by the way, I'm going to need your help. Not only are we going to be demonetized, but the reason I was late to the stream was I was actually on time. But then I went downstairs to get my tea because I put the kettle on. And I was met with a giant pile of dog excrement. Yeah, he's sick again. I have to take the dog to the vet. It's going to cost me $1 bazillion because every time I go, he has to be heavily sedated because he doesn't allow anyone to look at him or examine him or treat him. And his ears are infected, so he needs his ears done. And God knows what's going on with the gastro system now because he's, oh, God. So that's what I was doing, was cleaning up dog excrement. And it was a watery variety, which is the worst kind to clean up. I was holding my breath the entire time so I didn't throw up. So yeah, I'm going to need your help. So make sure that you click on the like and the subscribe, and also go to Super Tips. I'm going to open those up, actually. I forgot to open up Super Tips. Go to Super Tips and check out the fun AI voices because that's always a good time. And it's supertip.gg/Megan Fox. and you can support the show and help me pay the giant vet bill that I'm about to have. It's probably going to be like $500. I'm not even kidding, because they have to put him out to do any of this stuff. So he has to go under the general anesthesia to get a normal exam. Yeah, and to get his ears treated. So I'm going to have to pay for all of that medication, plus I have to get the medication beforehand. I have to pre-medicate him. Then we have to take him and he has to get put under. And then I have to deal with all of whatever the bill is. So please help. That's all I'm saying is please help. And also don't forget to visit the fundraiser for Carrie and Brady Timms, because when it is fully funded, we are going to be river dancing. That's right. And, you know, dime store prom dresses. That's correct.
What, Megan?
What?
I got my dress.
I got awesome. It. Awesome.
So
for a minute, I thought you were going to say that they did it.
No, I wish so bad, but I got my dress and I feel really excited because I hate stores. I hate shopping. So, and I couldn't try them on at this Goodwill. They had no way to try it on. So I had to guess. No. So I got two in hopes that one of them will fit. And you know, it's really
I got
weird.
A great deal on mine. I got it for $7.
Mine was 13 and 13, but
bad.
I'm going to return the other one. So
awesome. Awesome.
Nice.
I'm checking on the fundraiser. They're 47% funded. We're at $4,100. We're trying to head to a $9,000 goal. That is linked in the description of this video. Their GoFundMe, it's right here. If you can also look it up on GoFundMe. If you look up Carrie and Brady Timms GoFundMe, you'll find it. It's the one that says not guilty at the top. And we're supporting them, and we're trying to help them recover from the terrible things that the state of Georgia and this guy right here did to them. This guy right here. All right. Let's get going here.
Ms. Bernard may have some questions.
Thank you, Mr.
I'm sure Miss Bernard has some questions for him.
Good, Miss Bernard.
I'm so excited for this.
Oh yeah, that's right. Nick Starro is doing a fundraising stream this Friday. So that should be great because I'm gonna be there. Are you gonna be there, Flux?
See, I was planning on being there, but I'm just now realizing that's the night of the rehearsal dinner.
Oh, dang it.
For the wedding on Saturday.
Right, for the wedding.
I might not be. I'm gonna try and get there. I might be like not looking like this, you know, braids and stuff, but I'm gonna try and get there.
All right, cool.
All right. So let's so as you just said, the only time you've ever seen Jameson Timms is February 3rd of 2022, right?
That is correct.
Okay. When did you first become aware of his case as someone who had been admitted to the hospital where you work?
I can't give you an exact date, but we would have discussed him on trauma rounds. So that would have been prior to him coming to the clinic.
Okay. Would you have become aware of his case on January 13th when he was admitted to the hospital?
No.
Would it have been sometime between would it have been January 14th when Dr. Brown saw him?
No. So it would have been after. So whoever's on call that day for consults, whether it be myself or Dr. Brown or Dr. Pena, we become aware of a consult. The rest of the team doesn't, or our fellows will become aware of it. And then we'll discuss the cases when we have rounds on Wednesday, and we alternate between Scottish Rite and at the time it was Eggleston. So that's when I would have learned about the case.
Okay, so would that have been the Wednesday before February 3rd?
Possibly. It would have been either that or the Wednesday before that.
Okay. And when you become aware of a case, what information do you get and who are you discussing it with?
Oh, so in that context, I find out about it when we're doing rounds. So the trauma clinician, goes through the list of patients who are on there. Then whoever, if we did a consult on that patient, whoever completed the consult will talk about the patient. We'll look at all the imaging. We'll discuss the case. So that's how I would.
I'm with Allie. I hate
have a
his
multidisciplinary
I just
meeting
hate
that
him.
we have.
So would this have likely been, it looks like February 3rd, 2022 was a Thursday. So would this have likely been done on February 2nd, that Wednesday?
I really can't say. It would have been a Wednesday. That's when we have trauma rounds.
Pay close attention to how he tries to avoid answering this question. This is going to become important later. I have a confession to make. I watched ahead because I got so into it yesterday that I was like, I can't stop watching. I need to know. And by the way, I was screaming at the screen in my car. As I'm listening to it, I was driving and screaming at him. You liar! You liar! I mean, it gets intense.
I'm so glad you brought that up because I feel like some people might be really irritated with Catherine. Once she asks a question, she doesn't really accept their evasive answers. She pushes it and you're kind of annoyed, like, okay, Catherine, but if
move
you
on, lady. He said he doesn't know, but it's very important.
Yeah, it's his job to know. And if this is about Jameson, this is important.
And you had plenty of time. You had plenty of time to review your notes and look at the file before you came here today. So if you cannot answer the simple question, when did you first hear about Jameson Timms? When were you first informed? That's ridiculous. I'm sorry. That's absurd. And right now, go ahead and check off evasive answers. This guy fucking knows.
Well, and
he knows exactly when he saw Jameson Timms.
And look how he smiles about it. He's like, we're really busy over here kidnapping lots of babies. I can't keep them all in track. I mean, that's what he's saying. He's like, we're so busy. I can't do it.
Well, and for me, it's like, I am not annoyed by Catherine at all. Like instantly, I'm annoyed at him because he's not answering.
Right.
She has now asked him like in the span of the past 2 minutes, 3 times. And she's like, okay, so when, and it's like, I'm sitting here as a juror. I don't know where jurist came from. Doctorologist, the ists are in my head. But I'm sitting here as a jurist and I'm like, we're making up words, right?
Fine. We're making up words.
I'm just like,
answer the question.
Right? How do you not know when a child that you're taking away, like how do you not know anything when you first heard about it? Like she's trying to narrow down I fully appreciate she is trying to narrow down that time frame.
Because how many babies are you stealing? Like literally, how many?
How busy are you that you don't remember this very traumatic case?
Or
I don't believe you don't remember. I don't believe you don't remember it when you've been sued over it and you've had 3 years to think about what you've done. You know when you saw him. This is going to go on for a while, and watch him evade this.
How is it not in the file, and how did he not review it?
And so do you remember who you discussed Jameson's case with and where you got the records from?
Sure. So the way trauma rounds work is
well, and if I could just stop you, doctor, I'm asking specifically about Jameson Timms in this case. You know, usual practice.
Yeah, we don't want to know how your rounds
we want to know
work.
what happened with Jameson's case. Not
we've all seen Grey's Anatomy. We know how that works.
I have no recollection of
none
discussing him on trauma rounds.
Face?
He would have been discussed.
I am going to choose Violet.
All right, Flux is going to choose violence.
This guy.
It's like trying to pull his teeth out. Like,
I know.
Why is it this
Wait, let's go back. Let's look at the face. Let's look at the face. Look at the face.
If I could just stop you, doctor, I'm asking specifically about Jameson Timms in this case. You know, usual practice.
My cat's coming over to calm me down.
We want to know what happened with Jameson's case, not just what the usual practice is.
I have no recollection of discussing him on trauma rounds. He would have been discussed on trauma rounds.
But I have no recollection of it. You may also check off Flux is going to get angry because clearly that is happening. You can see it all over her face.
I am so happy I'm not one of those people that turns bright red because I would be a tomato right now. I am so livid. Like, you're a doctor. Everything is written down. How the fuck do you not know when you're discussing a specific case?
and you're going to trial over that case. And imagine being Brady and Carrie, that this guy who helped kidnap their kid is basically smiling and laughing like, I don't remember. I can't recall. I don't recollect. I mean, he doesn't care.
I'm too busy saving the world. Like, I saved this child. Let's just move on. That's his attitude. Fuck him. Oh my God.
In case the chat, someone in the chat, Emil said, 100% he's gay. Flux nailed that at 0.4 seconds yesterday. He hadn't even opened his mouth yet.
True.
And it turns out, yep, he has a husband. I mean, this guy, he's like a walking stereotype, unfortunately for him. He didn't get the memo that it's 2025 and gay dudes can just be normal now. He didn't get that memo.
Yeah.
So he's just a flaming queen. But there's nothing we can do about that, I guess. Am I allowed to say that? I haven't been canceled since yesterday, so I guess it's fine. I have my resident gay on the panel. She'll let you know if anything I say is offensive, and she'll put me in a timeout or something. But so far, so good, right? Right, Flux? We're good?
Oh, yeah. Oh, yeah.
Yeah, we're good.
Although also would be accurate to call him a flaming bundle of sticks.
Right. We'll leave that to you. Yes, I said at the Pride Parade, this guy for sure wears leather.
No, but you can say the bundle of sticks part.
I could say the bundle of sticks part. That's true. That's also true. How come I have this? I have a problem with my screen over here. Hold on. Let me reconfigure. There we go. Now I can change tabs. Okay. Here we go.
And it would have been one of the trauma clinicians who's a nurse talking about the case. This is what's in the record. Where then it would have been Dr. Brown.
Stop bullying the months.
Her consult.
I know June is terrified of me.
It would have been, if there were any social workers who were involved, them talking about what happened in the hospital, any follow up. We're able to pull up the reports, and we do this all over WebEx, which is like Zoom. So we're able to see the X-rays.
Yes. If you missed yesterday's drawing.
Okay.
So that's.
This is the drawing we gave it. This is his Pride outfit.
So if I understand correctly, at some time prior to February 3rd, 2022, there was a WebEx consult regarding Jameson Timms that involved you, Dr. Brown, one of the nurses that was treating Jameson, and social workers who are connected with Department of Family and Children's Services?
Sure. So there's a number of people who participate in that. It's our hospital social workers. It's my whole team. Some of the nurse practitioners will be on there. Our resource nurse, our fellows. If we have any rotators, we use it as a teaching opportunity as well. But then we're also reviewing those cases. That's when I mentioned the 3,000 some cases that we've reviewed over the past 3 years. That's how we reviewed them, is during that weekly meeting.
What happened to, if it isn't written down, it didn't happen? Because we know that that's what these people claim on some occasions when it suits them. If it's not in the record, it didn't happen. Yet at the same time, they want to say, well, I didn't write it down, but it did happen. They did this all throughout the Maya Kowalski trial too. They would use it to their advantage either way. And I'm sorry, if you didn't put that shit in the record, you're not allowed to testify about it, period.
Right.
Period.
When I was 17, I did work for a chiropractor's office, and I worked with medical records, and I transcribed the doctor's notes and had to translate that so that, it could be readable in the medical record. And you have to put every detail of everything in that note. You don't get to just, the doctor, let's say it is being transcribed. Oh, the doctor wrote, it could be. You have to write verbatim what the doctor says so you can treat that patient properly. You don't get to just throw random stuff around and be like, oh, it could be in the chart. Times everything is written down. What is this?
Yeah,
Agreed. Chat, don't get mad. I have to turn monetization on today. I have a vet appointment coming up. It has to happen. So don't complain. It'll only be every 30 minutes. You can handle an ad every 30 minutes. If you want me to turn off the ads, we have to hit higher than medium wage. Otherwise, we'll all be okay with a couple of ads. All right, here we go.
So there's a number of individuals. I can't tell you exactly who was on that because if people are off.
His face,
they
God,
won't
and his
be
head movements.
on the meeting.
Oh,
And I
shrug.
don't
Now
know-
we're
I don't
shoulder
have a
shrugging.
Attendance record for that day here.
Well, and I understand you're treating a lot of patients. This was 3 years ago, but surely you can understand why, here in trial for Carrie and Brady Timms, we're pretty much focused on just what happened with Jameson, right?
Sure.
Okay. So there was a big meeting that took place with a number of individuals, but you don't remember the names of any of those individuals or anything that was specifically discussed about Jameson. Is that right?
Correct. I can tell you, how those meetings run, which I did. There'd be lots of people there, and it's not just one case. We go over, 20, 30 cases.
Okay. So Jameson was one of 20 or 30 cases that you're talking about with a group of people that includes folks from Department of Family and Children's Services, Dr. Brown, various nurses, et cetera. Is that right?
That's correct.
Okay. So when you come in to do the exam on February 3rd, 2022, your notes reflect call information taking place at 2:00 p.m. on that day. Is that right?
Oh, here we go with the glasses on, glasses off thing.
I'm looking at page 192 of the CHOA records.
I'd have to see it.
wonder
The note,
if I
what I
still
what
have
I
that
printed out
video.
today is my consult note, which is everything that I authored. So I'm sure there's other things in the record.
Certainly.
Here's the copy of the medical records from CHOA.
Okay.
He thought he was gonna get off easy. He's like, well, I don't have the record. She's like, oh, let me help you. Here's all 500 pages, you bitch.
Did you see his face? He's like,
yeah, look at him. He's looking at it like it's a bunch of spiders. Look at his face.
Again, he had almost the same face the cop had when she put the pictures down in front of him, like you just dropped a dead child in front of him.
Today? You expect me to do work today? I used to have this really funny clip of the hair up, glasses on, glasses off, hair down, glasses on, hair down clip from Arrested Development. I was going to play that. It was so funny. That funny secretary, and he tells her to take her glasses off. And he's like, no, glasses back on, hair back up.
Yeah. That's Stephen
Because it
Messner.
gets worse. Yeah. It reminds me of him. I don't know what happened to that clip. I don't have it anymore in here. That sucks. Unacceptable.
Unacceptable.
Again. I need to get that clip back.
92 of that record, please.
Is it tabbed here?
I don't know that it's tabbed in that one. We were using that one
I
with
guess,
Dr.
Paula.
Brown.
I guess you can mark off hair talk. That was kind of lame, though.
Okay.
And so you note where it says the telephone encounter summary call information 2/3/2022 at 2:00 p.m. with provider Stephen A. Messner, MD, and the department is the SRSVB Center. I guess that's the Stephanie B. Blank Center.
It is, yes.
And so that's the department, and then under center, it says Child Protection Center, right?
That's correct.
So what would this call have been?
He even holds the record smugly.
So it says it's a telephone call encounter summary. When our intake coordinators make calls, they'll put notes in. I don't know. Everything here says, I'm looking here, there's a telephone encounter summary. Okay, call information 2/3/22 at 10:30 on page 181 for radiology. So that is the time that they were told to go to radiology. And then I guess the appointment is at 2:00. I don't know, it doesn't show up this way on the electronic medical records, but it does say that the progress note by me was at 2:00, and then I filed it at 3:56.
So would this have been you calling over to radiology or?
No.
you talking to the intake coordinator?
No. It's just something that Epic puts in here. I don't know why it says telephone encounter, but it says that also for radiology. So I'm not sure. That's not, when they print them out like this, it puts all kinds of other stuff in there, but that's not.
He's making shit up.
All right, check off making shit up
Okay, so
on the
the answer
bingo
is
card.
we don't know what the telephone call being referred to
It's
on
not
page 192.
Yeah, there's no telephone call.
Or you didn't put it in
So-
the notes.
I mean, if there's a note from like say if our intake coordinator
God, with the fucking
calls
eye
a
rolling.
parent or caregiver, then it'll be written out what they discussed. I don't know if it just generates that because it says it's the time of the encounter. I don't know. There's nothing written there though, like as far as a note that someone put in that they spoke to them on the phone or anything. And we wouldn't be calling them at that time. It may be, I don't know.
Well, I'm not trying to be tricky here. I'm just trying to figure out where you first found out about Jameson's case and the information that you received and who you received
Look
it
at this
from.
look he's giving her.
When I as a layperson go through these medical records, I looked for times that your name was mentioned.
Takes glasses off, then proceeds to squint.
I'm having a hard time seeing.
And I thought that might be things that you had done in relation to the case. But I guess your answer is you don't know what this telephone encounter summary is referring to on February 3rd at 2:00 p.m. that has your name and Child Protection Center next to it.
That's correct.
Okay.
Yeah. So on clinic mornings, we meet as a team. So I meet with whoever the clinic provider is. So on the 3rd, it was me. We meet with our medical assistant, our social worker, our child life specialist, intake coordinator, family advocate, and we go through all the cases for the day. So I heard about this case that morning, but I saw him on the schedule prior to that, and I can pull it up. I can't tell you the date, but it would have been before the 3rd. But I would have first heard about this case on trauma rounds when it was discussed, which would have been in the couple weeks before.
Okay. And I'm not trying to be too nitpicky here, but
Okay.
I do want to nail down, was it several weeks before February 3rd that you heard about Jameson Timms' case? Or was it February 2nd that you heard about it? Or just narrow it down for us as to when you first became aware of Jameson Timms' case as something that you would be responsible for seeing him, making diagnosis, evaluation, anything else.
So I would have become aware that he was on my clinic day. I don't know what day of the week this was. So it would have been probably the week before because I know that it's my clinic day and so I'm preparing for it. And I'm not trying to be vague. That's, all that I can really state.
Okay. So let's, moving down on page 192, we've got the progress notes by Messner, Stephen A., MD, also at February 3rd, 2:00 p.m., right?
Correct. That must have been the appointment time.
Okay. And the service is listed as child protection, right?
Yeah, that's how we're categorized. Like in Epic, it would say like cardiology or nephrology or child protection.
Okay. So it wasn't checking on rib fractures or anything specific about any injuries. It was child protection, right?
All of our patients are coded in the system as child protection because that's what our department is coded as. So like even if a patient comes in for
this part
sexual abuse, it's
me.
going to say child protection. And that's just generated by the computer.
Okay.
So a kid comes in with broken ribs, fractures, a compressed vertebrae, and they're coded as child protection. They're coded as child abuse. Does that affect the care they're given? Because it sure kind of seems like it. It sure seems like instead of getting treatment and care, They're getting investigated, right? Because Jameson
Yes.
didn't get any treatment for any of the things they said he had.
Right.
And I wonder if part of it is because of the way it gets coded in the system. And suddenly they're looking at this kid like a police project instead of a patient in need of care. You know what I mean?
Absolutely. That's the problem with this. When families come to us and we need to vet them, it is not that hard to listen to them talk. And when they say things like, we were kicked out of the hospital and it's been a year and I still haven't seen my kids' x-rays, that's a problem. They just put things in code and they're not actually taking care of a child. They are literally just kicking parents out and putting kids into foster care.
Right.
That should bother people. I don't understand why.
Well, and
more
it really
people-
bothers me that in Jameson's case, they didn't even inform the foster mother of his injuries. That
'Cause they
really
know-
bothers me.
They know how minute those injuries are, Megan. That's part of the problem here too. They knew that was not a compression fracture. They knew that wasn't. And they knew that those rib fractures that you'll later hear that other professionals don't even think were actual fractures. It's more like metabolic bone disease, issues that they can see on x-rays. They're so small.
They wouldn't have been causing any pain.
Yeah, it's like, no, you don't have to do anything. Just treat them as normal.
Which
And
is
they
why
know
they
that.
didn't give him any treatment. They know that.
Yes.
What do you think? What do we think? I know I don't want to get ahead of ourselves. I'm sure we'll find out what the compression fracture, what they believe it was, but I'm just curious. Is there any other explanation for that difference in height between the vertebrae?
From my memory, nothing significant. It was more just like how the picture possibly was taken. And
That's what I was thinking.
The pediatric radiologist said she would never, ever, ever have had a kid come in and someone on their team say, hey, this kid might have a break in their spine and not do an MRI. She said the fact that an MRI
that's crazy.
Is like, did they even believe this was really happening? Because why would you not
she's
do an
gonna
MRI?
get into that. She's going to get into that with him. And I think I was screaming at that point too, because it's like, how dare you justify not taking an MRI for a broken spine?
Right.
You weasel. Everybody knows you don't rely on an x-ray for vertebrae problems. You go directly to an
Especially
MRI.
an infant that can't tell you if he's in pain. He can't say when I sit, it
outrageous.
hurts.
Outrageous.
I mean, it's stupid.
Absolutely outrageous.
Not only that, those x-ray machines for babies are horrific. I don't understand.
Yeah, learning that they put the baby in straps like this, and they strap and hold him down, and while the baby's screaming, and sometimes they have to sedate them. It's that bad. Learning that, I'm like, yeah, they probably hurt him.
That's what I'm thinking. At Erlanger, when there were no fractures, supposedly, I'm wondering, did Erlanger do that? Did they cause these fractures to Jameson?
Right. Did
because
they pull
if
on
you're
him too hard?
squunching the baby,
they were squunching him on the thing.
Yeah, with his little
get
arms
squunched.
up. Yeah,
we can now all check off get squunched, because that's a thing.
I mean, and again, it's horrific. Their little faces, I mean, their tiny, cute little faces are all squished up, but it's like, those things are horrific. And I'm like almost certain they probably did it because they're not going to handle him with care like the parents. So if he's already fussy and they're trying to get an x-ray, the squunching is going to happen.
It's going to happen. And you know what? Also, by the way, it's I have seen medical providers treat babies with absolute barbarity. It happened to my son the day he was born. A nurse in the hospital hurt him and did it right in front of me and handled him so roughly that he cried so hard that he blew a hole in his own lung. He had a pneumothorax because she hurt him. And it was confirmed to me by the specialist because I was like, how did this happen? And he goes, well, he cried too hard. And I knew why he cried too hard, because she harmed him and she was so rough with him. She not only did she squeeze and pinch his skin, then when she laid him down, and she was so rough with him, like he was I don't know.
Because they do it every day, and not all.
And then she puts him out on this thing, and she goes to measure him with the measuring tape and cuts his little baby skin with the measuring tape, gives him a huge paper cut. Oh yeah, my husband and I both saw that. We were like, oh, He's bleeding now, and now he's screaming even harder because you literally just gave him a paper cut on that little tiny thin baby skin. Look, all I have to say is, that was my baby, and that woman, she no longer works with babies. Just let me tell you something. I made sure that she can only work in the morgue now, where there's nowhere where she can hurt anyone. She can't hurt babies anymore. But I went after her big time because that was horrific. And she caused him to have a very serious injury. He had a hole.
Lucky you didn't get charged for that, Megan.
Yeah, right? It's
Really?
a good thing I had so many witnesses, including the midwife who saw her do it.
And then, so as we move down, we've got name Jameson Timms, date of birth October 8th, 2021, age 3 months. Chief complaint is inpatient follow-up for child physical abuse, right?
That's correct.
Okay. And so now, is this a conclusion that you've drawn, or is this a conclusion that you are adopting from Dr. Brown or someone else?
Yeah, so that's the reason for the visit. So I'm basing that off of the diagnosis that was already made.
Okay. And just to clarify, because I think you talked about this a little bit with Ms. Fox and Mr. Hood, but did you see your role here as making an independent diagnosis of Jameson or following up on the previous diagnosis that was made by Dr. Brown?
So it's a follow-up. So I'm following up on it. If I, in the course of my evaluation, determined anything to be different, like if I found additional injuries or had a different diagnosis, then I would have stated that in my note.
Okay. So let me see if I understand your answer. I guess it would be sort of in between. You're not necessarily coming to it for a fresh perspective. You are taking into account the previous diagnosis, but you're ready to change it if you get new information. Is that fair to say?
I'd say that's accurate, yes.
Okay. So then we've got other agencies involved: law enforcement, City of Calhoun, Jay Faulkner. Did you ever speak with Investigator Faulkner on this case?
Sex scandal face.
I can't recall.
Sex scandal
You
face.
Can't recall if you spoke.
Look at this. There it is. There it is. Let's bring up the picture just in case I'm wrong, but I don't think I am. Oh yeah. Oh yeah. That's it. That's it right there. Who's got sex scandal face on their bingo card? Not me. Damn it. I have to write it down.
Oh, I do. Yes.
Bingo is getting so much harder to win these days. I'm telling you, it's epic. It's epic. This is an unbelievable exchange.
I can't recall.
You can't
You
recall?
can't recall if you spoke to the investigator on this case?
I can't.
Wow.
No.
Nope.
What a dumbass.
Boosh.
Okay. It also says the DFAX worker is April Hunt. Did you speak with April Hunt on this case?
I can't recall.
What?
Oh my gosh.
I may have spoken to.
Maybe I did. Maybe I did.
Maybe
Dude needs to have his
Anybody.
memory checked. Maybe he has early onset dementia or something.
I don't want to
Cross
say something
amnesia.
that's incorrect.
And I certainly don't want you to say something that's incorrect.
I won't.
Oh,
I won't.
Oh man, what a bitch! What a bitch! What a
Megan,
bitch!
This is why people hate gay men. He is the reason people hate gay men.
If you want to know why homophobia exists, it's this guy.
But
right
listen
here.
to
An asshole.
For him to so quickly, before when he was kind of just mimicking their standards, like, oh, well, when we have a case, this is how we handle it. It's interesting that now all of a sudden it's not part of their case to talk to law enforcement or DFAX investigators. Isn't that a little weird? Wouldn't you think he would play a part in that and say, well, typically we do speak with the investigators from the Department of Family and Children's Services and law enforcement. But it's easy for him to be like, no, I don't think so. That's crazy.
Good point, Flux. Except for Megan's homos. Hashtag Megan's homos. None of us hate any of you. We love you
The
because you're
gays
normal.
here are based. Gays
Right.
here are based. Not you guys. It's the other
It's
gays.
these guys that give the gays a bad name. You know?
Yeah.
Because the gays are mostly great, except for these ones.
Except for this asshole. And these are the outspoken ones that are screaming about.
These are the loud ones who are out there
stuff.
making it suck for everyone else.
Yeah.
Both of them. I'm not certain. I don't want to
Oh, what a bitch.
say
Check it
something
off.
that's incorrect.
And I certainly don't want you to say something that's incorrect.
I won't.
Oh. I won't.
And so just to be
I
clear,
cannot roll my
obviously
eyes
this
hard
happened
enough.
over 3 years ago. So are you saying you don't remember if you spoke to them around the time of you seeing Jameson Timms, or you don't remember if you've ever spoken to them throughout the 3 years that have happened since then?
The chat is killing me. Billy says, nobody hates gay people like other gay people.
They give us a bad name. They make everybody hate us.
Lazy investigator. Yes. Oh, Jennifer just accidentally, she popped off. She'll be back. Oh, she may have a phone call. I forget. She's got a phone call she's going to have to make. Lazy investigator. Yes, we may check that off. Also, oh, she's back. There she goes.
Oh, yeah.
There we go. No, you're fine. Lazy investigator can be checked off the bingo card. And I don't have it on mine. Dang it. Yeah, this is definitely lazy investigating. He didn't talk to the head investigator on the case. He didn't talk to the case manager. He didn't talk to the investigator at DCF. Nope.
You just took Verena Brown's notes, right? Like that.
You know
that's
what?
it.
We also should be able to check off didn't do nothing, because this guy didn't do nothing. Like it's a little bit different of a context, but I'm calling it didn't do nothing. Check it off.
Like literally.
Hundreds of patients every year. Law enforcement and DFCS are involved in most of those cases. I can't recall specifics in this one.
Okay. Well, and actually let's loop around a little bit, because you mentioned seeing hundreds of patients, and when you were speaking with Ms. Fox earlier, you were giving us some figures on the number of cases in which you have made a diagnosis of child abuse. Can you tell me about any cases where your colleague has diagnosed child abuse, the child has been removed from the custody of the parents, and then you have gone back and said, no, it wasn't actually child abuse?
I can't. Our practice is to be very conservative. So if we have any
very conservative,
that's questionable, then we don't make the
You just
diagnosis.
said hundreds of cases a
be
year.
suspected at that time. So I can't recall any case like that.
Okay.
In other words, every single case that has ever been diagnosed child abuse, this guy stands behind. He's never once gone back and been like, nope, you've got this wrong. And his explanation for that is because we're so conservative that we don't get it wrong. Bullshit. There's nothing conservative about this guy. Sorry.
Nope.
Nothing.
Nothing.
Absolutely nothing.
So do you know when Dr. Brown made the diagnosis of non-accidental injury?
I don't know the specific date. No.
Do you know if it was before or after Jameson Timms was
Exactly.
taken into DFCS custody and his parents were escorted by security out of the hospital?
I don't.
Seems like that would be important to know.
Right? Maybe
All
a little
right,
bit.
so back to the progress notes that you made on February 3rd. And you mentioned, that, of course, the aunt and the grandmother are there. Do you remember who the rotating trauma NP was? Nurse practitioner?
No.
Oh my God, that
And he's
face.
got
Oh my God. He is, the disrespect in his face.
the
Look.
grandmother are there. Do you remember who the rotating trauma NP was?
Watch. Look at
Nurse
that.
practitioner?
No.
No.
Okay.
I can't even with this guy's face. He might as well say, I can't believe you're asking me that.
Yeah, see how smug he is?
Ah,
it's gross.
No, you're not wrong.
He just needs a snap.
Vibe flux. Yes, blink rate anomaly. The blink rate did just go abnormal.
And we've got NP
look at the eye rolling too.
Do you remember who the rotating trauma NP was?
Look at that.
Nurse practitioner?
No.
And laughing.
And we've got a forensic specialist who was present.
Does
what's
he
the
know
forensic
he looks like
specialist
a
role?
dumbass?
Yeah, so
Does he know? I'm sure he was told in middle school many times. I mean, just saying.
You should have listened to him.
Blink rate anomaly. I don't think I have that one. That's a picture one. I don't have that one on my card. Dang it.
those are our social workers, and they're all trained forensic interviewers. So in cases where we're not doing a forensic interview, which is where they sit down with kids to ask them in a non-leading fashion, and they get an interview of them. Since they're all social workers, we utilize them in a social work role if we're not doing a forensic interview.
Hey, Carrie.
So the very first thing after the referral information, which is, initially having the child abuse evaluation on January 14th, the very next thing is per Dr. Brown consult note. And so here you just quote 5 paragraphs of Dr. Brown's consult, right?
That's correct.
Okay. And so that impression includes a prior history of bruising with concern for non-accidental trauma.
Correct.
Okay. And do you know anything about the source that Dr. Brown used to get that information?
Yeah, it says here, mother showed our team photographs of the bruising as well. They appeared significant. So that would have been directly to Dr. Brown because that's in her note.
So you're saying that my client, Carrie Timms, was the one to show these photographs of what was going on with Jameson to Dr. Brown. That's what's reflected in the notes?
It says here, per review of the medical records, there was concern for non-accidental trauma in November when Jameson was admitted to Erlanger for bruises. Hematology workup thus far has been negative. Although Jameson was not our patient during that admission, we were highly concerned for non-accidental trauma. Jameson was approximately 6 months old at the time of the presentation. Children of that age are not developmentally capable of causing such extensive bruising as described in the record. Mother showed our team photographs of the bruising as well, and they appeared significant. Yes.
Okay. So did you ever speak to the pediatrician with the child abuse specialty at Erlanger who saw Jameson in November of 2021?
I didn't, but Dr. Brown did, yes.
Okay. Do you know any reason why that pediatrician would not be brought forward to testify in a case like this?
No.
Time out. So that's not entirely accurate because Garcia is the one they're referring to that Brown talked to. Garcia never saw Jameson until about 2 weeks after for a follow-up. She never saw these markings. So it's just, these markings are notated in the record, but no one actually laid eyes on these markings. It's just what Garcia read in her record. So it's just, he said, she said, all the way from Tennessee, all the way down to Georgia. So no, Dr. Brown didn't even speak to the person who laid eyes on Jameson during our Erlanger stay when the markings were present.
That's weird. Also, you're going to notice that there's a bunch of weird stuff with the, is there an echo? What am I hearing?
Is it my car? I'm sorry.
It might be. It might be. I'm not sure. I'm looking at your volume. Well, the chat's saying they're having a hard time.
Warmer noises. That's cool.
It is cool. It kind of sounds like water dropping or gaming noises. I don't know. What is it? Okay, there. It's not. Yeah, it's gone now. It is super spooky.
It was the engine of my school bus that I drive.
Well, it sounded like we had been transported to some other portal. It was voices in a cave. Yeah. Yeah, I can hear a witch, says Volstorm. Yes. Yes. Maybe we have a witch sighting, but no, Carrie's not a witch. But yeah, no. So the weird thing is that the bruises becomes a really interesting part of his testimony, because we start to understand that, wait a minute, you're calling something else a bruise that wasn't a bruise. And now we are not sure who actually saw the bruises. Wait, mom's the only one who showed you pictures of bruising. It's crazy. Bruce says it's the remainder of this guy's soul leaking out.
And from what I can remember, I mean, the bruise was like that big, right? It was like a spot on his back.
Yeah, tiny.
Children's Healthcare of Atlanta, it was just like a tiny dot. But the ones that they keep referring to are the ones on the long bones that we took him to CHOA, to Erlanger for.
Erlanger, the first visit, when they didn't find any child abuse or whatever.
But the state never even put those into evidence because they knew
we have no pictures.
It's not physical. They knew that it did not look like abuse. That's why I think they never put it into evidence. They knew it looks like a medical problem.
I'll send the photos to you, Megan, for when the pathologist testifies, because they do not ever get brought up. But I'll send them to you. That way the viewers and everything can get an understanding, because even the layperson can look at those and be like, that's not normal, because the first thing I thought of was leukemia.
Right.
So they're making such a big deal out of these.
Yeah.
They're talking
and that's
about
what they wanted to test
they
him
don't
for.
even have but they don't even have evidence they're presenting of this at all.
No.
Right.
The state never put it into evidence.
To say that I love how much you guys love this individual. I went back and watched yesterday's.
Did you like his costume that I put him in? Because that's a lot of fun.
No comment for church people that may be watching.
Do you know why Dr. Brown would have chosen not to include those photographs in the medical records?
No, I don't know.
Because they're exculpatory, maybe?
It was a technical thing or what? I have no idea.
Did you ever get curious about it, since you were doing so much writing about conclusions about these photographs?
About why they were not, why she didn't put them in?
I mean,
No.
or what they showed, since obviously you're trying to figure out what's going on with Jameson, right? You're not just trying to confirm what somebody's previously done because they've already taken the baby away, right?
I love that she's meeting his snarkiness, but not
Dr. Brown did not take
in
the
like
baby away,
a
if that's what
negative
you're
way.
saying.
I love her.
She didn't
My
say that.
role was to.
He said Dr. Brown did not take the baby away, but that's not what she said. She said since they already took the baby away. So she's that's him cover CYA.
Yep.
Do the follow-up evaluation. I reviewed everything that was in the records, trying to explain to you how the medical records work, what's documented.
I'm sure the jury just loves being
So
explained to by you, by the way. I'm just trying to explain to you how medical records work. Oh, F off. No one cares about to be lectured to about how your medical records work. Do not talk to people like this, by the way. If you are ever a witness on the stand, do not ever talk to the jury like this, like they're stupid, because you will piss them off. That just pissed me off. Don't try to. I know how medical records work. I've gone to the doctor my whole life. I have medical records. We know how they work. You're supposed to write this shit down. Yeah, you're mansplaining. Stop mansplaining to me how medical records work, you dumbass.
He's the one who doesn't know how they work, because earlier he's like, I don't know, Epic must have just done this. I don't know how that got there.
How about when he doesn't know when he doesn't even know how to write down when he had phone conversations in the medical records. Someone needs to teach him how to put medical records together. You're absolutely right. My blood pressure meds are not working anymore, Donna Shepard. Damn it. Check it off the bingo card.
I'm basing my current impression on the updated x-rays, my physical exam, what's been previously documented, what the previous labs are. So that's how I come to my conclusion. Now, I can't control, whether or not those photographs were in the record, that was out of my control.
Could you ask Dr. Brown about them?
I could, yes.
Did you?
I know I've.
I could, but I didn't. Awkward pause.
Trying to
You
think
could
when
drive a train through
when
that
we
pause.
discussed the photographs. I have, yes.
What?
Did you receive an explanation that satisfied you as to why these photographs were not part of the medical record?
Oh, that wasn't what I asked her. Like, I didn't ask her.
What did you ask her?
I asked her about the photographs.
What did you ask her?
What about them?
Like what she
If it-
observed in them.
Okay. I mean, isn't it kind of like, wouldn't you like to see the photographs themselves rather than just hear someone else tell you about them?
Well, if we had access to them, sure.
Why didn't you have access?
Did you not have access?
But that didn't really play into the current injuries that we were seeing during this hospitalization. So
So
we're
history
seeing recent injury to the mouth and the face and the
What?
healing fractures.
Who's buying this?
And then we have this historical.
But this does not answer the question. Why didn't you look at the pictures?
Yeah. He let
Because
Brown
it wasn't a
describe
photo of
them.
himself, ladies. It wasn't a photo of himself.
I don't-
And that's all
True.
he's worried about seeing.
I don't
True.
know if the jury is in my boat, but I'm broke, so I don't have enough money to buy this bullshit story he's selling.
Nobody does.
I'm too broke for this.
price? Have you seen the price of meat? We don't have a damn dime left for this guy and for his lies. Let's take a break
I'm not
for a
buying this
second.
story.
I'll take a break for a second and get to a couple of the super chats. Liz Bird, thanks for the 5, says vet bills or whatever. I don't require receipts. Great. Thank you, Liz. I appreciate that. And Rozilla's Realm, thanks for the 2. How do we get Megan to say invade Canada? Wait a minute. You stop it. You're cheating on bingo. I can't just say it reading it from a super chat. It has to be authentic. But I do think we should invade Canada. I mean, what they're doing to those ostriches is terrible. And now you can check off invade Canada and bird talk. Look at you go. I think I have bird talk. Do I have invade Canada? No, I don't. I'll write it down. Invade Canada. All right. Also, there are super tips. Yes, there are super tips. I think Mary Lankins has something to say. Mary, thanks for the 5.
Megan, this man definitely has a very tidy bush and wears Bonnie Bell lip smackers glitter gloss.
Mary would know. She is our foremost expert on trimming bushes, and she knows because her neighbor is constantly running into hers. So there's a it's a whole thing. Jennifer's face. Annie, thanks for the 5.
Dave the donor, you can stop sending me donations. Donate it to a truly innocent family.
Right.
We don't need the barn. The shed is just too beautiful to move out of.
Yeah, Dave the donor should take his hundreds of thousands of dollars that he has to throw away on a couple of dummies and give it to Carrie and Brady Timms. He should be doing that. This is a great idea. Thank you for bringing that up because we know this guy who likes to throw money at truly ridiculous causes. And if he would just grow a conscience, he could change lives in a really good way instead of donating money to ridiculous, guilty people who stalk their neighbors for a living. It's bizarre. Absolutely bizarre. But I don't really have much faith that will happen. Emil, thanks for the 2. Alberta is looking to secede. No need for an invasion. We'll take them. We'll take you. I mean, we could handle a 51st state, I think. And definitely after this ostrich thing, seriously, after the ostrich thing, I'm not even going to want to visit Canada. Okay, Canada is on my no-go list after this. It is, if you can kill those birds, I don't want to know you.
I think.
All right.
I think I may have partial citizenship because my mother is a Canadian. Well, she has dual citizenship, so I think I could like sneak in easier because, like, I don't know, parental access and stuff. They like that over there.
I know my voice is going. You can tell. I was so sick over the weekend, but the good news is I feel really fine right now. I feel good. I just don't sound good. You're just going to have to put up with whatever this is that's coming out of my mouth.
You look great. No one has said that, and I find that weird because I think you look awesome today.
Well, thank you.
You do.
I
You look super
appreciate
pretty.
that. I appreciate that. All right, here we go.
Account.
Let's back up
and
to
then
make sure we have the
on face and
context of this
so
ridiculous
we're seeing
testimony.
Recent injury to the mouth and the face and the healing fractures. And then
He's going to start with his weird mouth noises too.
Account. And so that's really, I mean, if they were available, it would have been nice to see them. It wasn't something that
they weren't available?
that was
They're
pursued.
not in the record?
If we could flip over to
wasn't
page
pursued?
200, your impression of Jameson Timms, it includes, there was also a history of prior bruises that were evaluated at Erlanger when he was 6 weeks of age, and Dr. Brown's review of those photos indicate that they were also indicative of child physical abuse, right?
That's correct.
Uh-oh.
So, but are you still going to take the position that her alleged findings of what happened in November 2021 were irrelevant to your determination of child physical abuse?
So it's interesting wording about taking a position. So I'm explaining to you my
Yeah, I'm sure.
impression. I put that in there because it's part of his history. That is part of this this impression. And so I'm documenting that. Of course, it does, tell you the historical context of that there were prior injuries to this baby. We know that there are prior injuries to the skeleton. We know that there are recent injuries to the mouth and to the face. So it's one baby, all of these injuries.
Well, I'm glad you brought that up. Can you show me the photograph that Dr. Brown took of this alleged injury to the baby's mouth when she examined him on January 14th?
So there's not a photograph from Dr. Brown, but there's this photograph, which was States Exhibit 1.
There's other photographs that Dr. Brown took on January 14th, aren't there?
That I can't state right now.
Okay. Well, and how about, are you familiar with the consult?
Wait, the chat just told me there were annoying hand gestures. I missed an annoying hand gesture?
There's been annoying hand gestures through the whole thing.
What did I miss?
That I can't state right now.
I can't.
Okay. Well, and how about, are you familiar with the consult?
I'll point
notes?
one
And
out
if I
next
could
time.
ask you to flip to page 30 of the medical records from CHOA. About 2/3 of the way down the page, do you notice any notes about the status of Jameson's frenulum on January 13th when he was admitted to CHOA?
I do, yeah.
Does it say frenulum appears intact at this time? Red dot noted under tongue?
That's correct.
Okay. Would it have been valuable to have a photograph of what Jameson's mouth looked like on January 14th, 2022?
I think it would have added. It would have been nice to have. It doesn't change the documentation. I mean, we have a photograph from before. We have documentation of injury under the mouth or under the tongue. So to have a photograph, sure, that would have been
All right,
great.
I'm going to let you have annoying hand gestures.
And
It's starting
do
to
you know
annoy me
anything
now.
about the circumstances of the photograph that was taken on January 12th and that you were just looking at? Like who took the photo, or whether the child had a runny nose and the nurses were using a suction apparatus in his mouth?
I know that that was taken by primary care
my.
physician. I believe it's Dr. Garcia or Harbin.
Hold on. Wait a minute. They were using a suction thing in his mouth before the injury? Is that what I'm understanding?
He had a runny
Excuse
nose
me.
during that time.
What now?
Yeah.
So it's possible that they injured him under his tongue?
Definitely.
Oh my God. Oh my God. Yeah, Bush points out, would have been great. You mean actual documentation would have been great? Why didn't you do that, sir?
It's so weird that he can say it'd be nice, but we still went with the same thing even without the picture.
All right, I'm going to go over the bingo with you so that you know what we have already checked off. Evasive answers. What a bitch. Meg's blood pressure meds stop working. Annoying hand gestures. Free space. They're making shit up. Baby stealer. Flux chooses violence. And bird talk. Plus, the ones I don't have. Flux pets cat. Flux is going to get angry. Hair talk. Squunched. Get squunched. Sex scandal face. Lazy investigator, didn't do nothing, blink rate anomaly, awkward pause, and invade Canada.
Well, you might as well check off state lies and defensive body language because those eye rolls and those smug faces.
You're right. State lies and defensive body language. Yep. Oh, Carrie's back. So there she is. Okay. Holy cow. There she is. She's back. All right. Let's get back over here to this bitch.
But that's the extent of what I know.
Okay. But in forming your conclusion that Jameson was the victim of child physical abuse, you refer to the fact that he had a mouth injury, correct?
That's one of the injuries, yes.
Oh, yeah, you're right. You're right, chat. Also, check off unfucking real. Because now we find out that the mouth injury, after all this time, we find out that they may have been the ones to do it to him. Would that have been at Erlinger?
No, at the pediatrician's office, Sarah Harbin's office.
Oh, my God.
The day that
so
they
at
took
the
the
so
picture.
Harbin Picket, this bitch, if you remember her, hold on, I gotta find her. Where is she? This one at her office, they were using a forcible suction thing to get snot and stuff out of his. And why were they using that in his mouth?
I don't know. Well, Carrie might can speak for it, but I know that they used it in his nose, and that's when they started taking the stick to look around in his mouth. Were they originally looking for a red throat? I don't know. I don't know what these people are doing.
It was the popsicle stick. It was just like a regular popsicle stick, shoving it, moving his tongue around, making it, in my opinion, worse than what it was. Because what I pointed out was a red dot under the tongue. And then it went into, oh no, you force-fed this baby.
So you saw a red dot. She goes under there to look at it, poking around with a popsicle stick. Aggravates it, causes a line then. Oh, that makes sense. Yeah, unfucking real. Please check off unfucking real if you have it on your, because that's crazy. So now they're the ones who caused the injury, but you're the one who gets charged with child abuse. I mean, it's every bit as plausible that they caused the injury as you did.
Mm-hmm. Yeah.
Mm-hmm. That's bullshit. Where's my button?
You will pay for what you've done. And I pray that God send angels to visit vengeance upon you.
That's the level I'm at. That's amen. I pray that God sends angels to visit vengeance upon thee. That's the level that I'm at right now. Dang it.
So flipping back to February 3rd, the time that you saw Jameson, we've got Dr. Brown's consult, which we've just gone over. And we've also got some history obtained from Brittany and Renee Timms. Were you the one obtaining the history, or was this the forensic specialist? Who was speaking to Ms. and Ms. Timms?
We were all in the room together in our conference room.
Sounds like a great
so
time.
I can tell you exactly who
Can you
asked
imagine
those specific questions.
this
The
group of
Hellfire
people?
Club.
The
But we
Hellfire.
were all
Were
there.
you wearing your druid robes at the time? Did it sound like this? Were you sacrificing small children? Drinking the blood of your enemies? What was happening in that meeting, sir?
Okay. And so during the course of this consult, you learned that Carrie and Brady Timms see Jameson at this time, February 3rd, that they were seeing Jameson on a daily basis at the home of the aunt, correct?
That's correct.
And they were also having supervised visits for 8 hours a week, correct?
That's also correct.
I just realized I have a button for that meeting.
Oh, I'll see you at the feast tonight. Oh, we'll have lots of blood and semen. Oh, good.
I haven't had a chance to pull that out in a long time. It was a spirit. Maybe they were spirit cooking. Maybe.
Okay. And Brittany and Renee both asked you about the possibility of brittle bones, right?
They did, yes.
They asked you about the relevance of blue sclera being a sign of some kind of fragility, right?
They did, yes.
And
at any point during your supposed investigation, did you think, gee, I'm an asshole? I would pay money for a lawyer to ask a person like this that on the stand. Was there any point in this investigation where you looked in the mirror and thought, I don't like what I see?
Are we the baddies?
Are we the baddies? Marco, I'm sorry. This is your fault for listening without headphones. I can't help you. There are going to be gay jokes. There are semen jokes. I can't help you. You need to be wearing headphones. If people are looking at you now strange, this is your fault. It is on you. You have been warned. You know what this show is like. You know what we do here. Like, I had to warn Carrie going in, and God bless her soul. She was like, I love you just the way you are. How sweet she is, But you guys should know this by now. You know this. Don't listen to this in public without your headphones on.
Renee reported to you that she had blue sclera, right?
Oh my God.
And she said she denied having any fractures, yes.
Okay. And both of them
That she knew of. That she knew of. They don't go around just doing x-rays of babies back then.
How is she related to Jameson?
That's his grandmother, his maternal grandmother. It's Brady's mother.
So she had the blue sclera.
Yes, up until age, I think 2. They had an image, but it's faded so much these days. I mean, I'm not saying she's old. She's not old. The photo's old. But it has faded so much that you can't see the blue. But her eyes, the whites of her eyes, just like the ones I showed you the other day, blue, blue, blue.
Carrie, I am so concerned that your vehicle is infested with demons. I cannot get over that sound. You've got to listen to this on the playback. You're not going to believe what it sounds like. I am concerned. We need to get a priest to exorcise whatever's going on in that vehicle.
Al Jameson could have had his rib fractures without any bruises on his body, right?
They did, yes.
Okay. They were asking about issues with bone density, etc.
Correct.
And you told them you can't do a DEXA scan of a child who's only 3.5 months old, right? Just because there's not a reference range.
That's correct.
Okay. And so, was there anything about your interaction with the family members of Jameson who had been legally placed as his custodians caring for him? Was there anything about that interaction that gave you concerns about child physical abuse?
No.
In fact, it's probably accurate to say that they seemed very invested in figuring out what was going on with their nephew/grandson, correct?
Sure.
So then we move down to medical surgical history, which is we've got a little blank there. So there's no information about medical or surgical history.
That's incorrect. That's
okay.
Oh, it
that's
is?
all of what's underneath there is the medical surgical history.
Okay. Well, so and under that, I see active ambulatory problems and then diagnosis.
Correct.
And so one of the diagnoses is abnormal bruising on January 13th.
Correct.
What was the abnormal bruising on January 13th?
Now that gets populated into the record. So if I look back on so there's a photograph here from the ED. So it's the bruise on an abrasion on his cheek. And if it was on the 13th, that would have been entered by
Excuse
one of the
Excuse me, what now?
providers.
The bruise was the abrasion on his cheek?
Yeah, there's no bruise on the cheek, dude. No.
So, excuse me, wait a minute. So not only are your medical records incomplete, not only did you not add photographs you should have added and write down stuff like the day you came onto this case, you didn't do that. Now you've written down that he had a bruise on his cheek. There was no bruise on his cheek. Dan Davis, we've already checked off awkward pause. Yep, we have done that.
There. I'm looking at Dr.
Munchausen by
Mellencamp's
morons.
note from the 13th. Potentially he put that in. He has a photograph in his note of the cheek.
Really? Because that would be what I would call inaccurate.
He documents
he's talking
previously evaluated for
Yeah,
unseen
who is the
bruising.
he?
Yeah, which he?
Isn't he the he? Isn't he the he?
I don't
in
know
the
of
records?
another male doctor that was on this case.
Deep sigh.
He's so irritated. This is the most work he's ever
So,
had to do.
The way the medical records work is if there's an active, what it says there, active ambulatory problem, it pulls it into the note. So that's where the abnormal bruising was how he coded it.
Okay. But so what was the abnormal bruising? What is that referring to under diagnoses for January 13th?
It's the code that he put in when he saw the bruise on
Oh
the
my
baby's face.
The bruise on his
Wait, there's
face.
a bruise on the baby's face?
Excuse me, what
Well,
now?
there's an abrasion. There is some surrounding bruising, what I'm seeing there.
Oh,
He
really?
documented it as,
Bullshit.
there's a photograph here.
Wrong.
What the actual fuck is happening?
Making crap up.
He documented it as a wound, light brown in color.
Right to jail, right away.
I mean, that would be my.
This will get awkward.
What?
Best
Guess?
explanation for how that got in the record would be from, because he's
Did
the
he
only
just
one
say
who
it's
saw him
gonna
on the
get
13th that I can tell.
No, that was one of my buttons.
Oh, I was like,
It's in his head, though. It's in his head.
That was Greg Woodnick, but we have reached the part of this testimony where I have no choice but to play this clip because, oh my God.
Bitch, what the fuck? Bitch, what the fuck? Bitch, what the fuck? Bitch, what the fuck? What the fuck? What the fuck?
Honestly, man.
Brady said yesterday when we played that, he said, that is the most annoying sound I've ever heard in my life. So I've got to find it so I can just play it at random times. And he's listening now, so I'm pretty excited. He's probably like, dadgummit.
The demons are now coming through your phone.
I was
What in
going to
the
say,
world
what is that? It sounded like frogs.
Is there Every other word, there's someone going.
I'm getting my laptop. Give me a minute.
All right. Maybe it's the sauna. I think we need an exorcism for Carrie's electronics. I'm getting concerned.
That was weird.
Carrie, what the fuck is that haunted frog?
You want to know that I didn't hear anything. She sounded perfectly fine to me.
What?
Really?
She sounded I'm like, what are you guys talking about? I didn't hear anything.
It was
Are you
weird.
serious?
Yeah, no, I'm like, what are you guys talking about? I didn't.
It's y'all's electronics.
I hear it now.
Yeah, I heard it that time.
What the heck is it, Carrie?
Time.
No, Carrie, keep talking. This has never happened before on a live stream. We want to hear
Fine,
this.
I'll keep talking so you can make fun of my demonic things on my phone until I get my laptop hooked up here. So I'm talking.
When you hear it on the playback, you're gonna die laughing.
It's like so weird syllable and slows it down to like the sound and then like goes back to normal.
Look at Carrie, she's so long suffering for bullshit. Look at her.
Can we add demonic phone to the video?
We need to put haunted
Demonic
electronics.
Demonic electronics. That sounds pretty good.
I like that. I like demonic electronics.
Oh my gosh. It's so weird.
I don't even know what would cause that. Like
I've never heard that before ever.
Satan himself causes it.
But my
That's
God,
true.
You add that to what was going on with her car with the haunted cave noises. What is happening? Everyone needs to pray for Carrie like right now.
It wasn't messing up her voice though. That's what's weird. It's like her voice
it was
stays
just
normal.
first it was
I'm about
this
to
weird.
rebuke it in the name of Jesus.
I know, right? First it was this weird background like cave noises, and now it's this weird frog noise. Poor Carrie. She's like, why am I putting myself through this?
Give me 3 minutes.
All right, you got it. You got it. We're here for you.
Ooh, that was weird.
So if I understand you correctly, you believe that the statement of abnormal bruising that appears in your report from February 3rd, 2022 actually refers to an abrasion on the face. Is that correct?
I think that's likely. So like I mentioned, the way the medical records work is so when they put the bill in, it pulls in these different codes, like however you code it, like you have a runny nose or a bruise, and then that puts it onto the active ambulatory problems, and then that gets pulled into the note. So that would be my best guess as to how this got in there.
What?
There was definitely an injury on his face. That's the only thing that I'm seeing here in the active problem list that refers to a cutaneous injury. So that's how I drew that conclusion.
Okay.
It just puts NAT.
So also under diagnosis, we have closed fracture of multiple ribs of left side with routine healing. And that has January 14th, 2022 as the date noted, right?
Correct.
And that's referring to the rib fractures that we've discussed already, right?
Correct.
And then also under diagnosis, it says non-accidental traumatic injury to child. Date noted, January 14th, 2022. Does this suggest to you that the diagnosis of non-accidental injury to Jameson Timms was made on January 14th of 2022?
Not by my team. It may have been entered into the chart, like I mentioned before, when you put the codes in.
By who?
By whoever was seeing the patient.
Well, who was
maybe
that?
It was one of the hospitalists. I have no idea. But
Well,
somebody
on.
did put that diagnosis
Somebody.
in then. Yes.
Okay, so someone, we don't know who, put in a diagnosis of non-accidental injury to Jameson Timms on January 14th. Is that right?
That's correct.
So if Dr. Brown testified that she didn't make that diagnosis until January 18th of 2022, who would have been responsible for making the diagnosis of non-accidental injury to Jameson Timms on the day that he was taken away from his parents?
I don't know. It's whoever put that into the code.
Yeah.
It
Spider-Man
says it's
meme.
noted that day. I don't know.
Spider-Man meme.
It's
It wasn't,
not noted today.
as you stated, it was Dr. Brown made the diagnosis days later.
Oh my gosh.
So I can't tell you who put that in.
Well, you
Guys,
said there's,
he runs the
so it's
program.
you and how many other
Wow.
pediatricians with a specialty in child abuse work at CHOA?
So there's 3 of us total. Yeah.
So,
Well,
So if it's not
four.
you or
Dr.
Verena, it must have
Bryant
been the
is
other
at,
one, right?
East Spalding.
so it wasn't you that made the diagnosis on January 14th, right?
That's correct.
And it wasn't Dr. Brown who made the diagnosis on January 14th.
That's correct.
It wasn't Dr. Bryant.
That's correct.
And who was the other doctor you said? Dr.
Dr. Pena.
Dr. Pena. And it wasn't Dr. Pena who made the diagnosis.
That's correct.
So what doctor could have made the diagnosis on January 14th?
Any of the other, whoever has access to the medical record is documenting in there. When they finish their note, it prompts you to put in diagnosis
Oh,
codes.
whoops.
So
That was a mistake.
It's kind of a,
Accidental button.
a
Megan
product
hits
of
wrong
the
button.
medical record.
Well, so, again,
All right,
as a
Carrie's
layperson
back.
here.
All right, Carrie. Let's test this out now.
Testing.
No, it sounds pretty good.
Yay!
The
Old
chat
school,
was
cheap old school for the win.
the chat
Hell
was
yeah.
concerned that when you came back there would be growling coming through. No, you're all good now. You're all good.
Perfect.
I just hit the wrong button though. That should be checked off your bingo card. Megan hits wrong button. If it's still there. I don't know if that's still there. Is that still there?
Yeah, it is.
Okay. All right. So I definitely hit the wrong button. That was not intentional. All right. What were you trying to tell us before you were so rudely interrupted by that haunted frog, Carrie?
Which time?
No.
I'm so stressed out. I'm eating support these things. Okay, I don't know if I can say the brand on here. I don't even know, but
Oh yeah, you can say whatever you want. We don't care.
brought to you
But
by
those-
Support Oreos because that's what I need right now.
we should all have some support Oreos.
Oh,
And
man.
I need some of
What
those.
was I trying to say? I don't even recall.
That's all right. Don't worry. You'll have plenty to say as we keep playing this.
My understanding when we went through your credentials about the importance of being board certified and licensed to practice medicine is that you have to be a board certified physician with a license to practice medicine in order to make a diagnosis. Is that correct?
That's correct.
So I will ask you one more time, who made this diagnosis on January 14th? Or is your testimony that there was no diagnosis made?
Well, clearly
This'll
it
get
was
awkward.
noted on the 14th. It's here in this note. I don't know
What's
who put
funny,
that in the
sir?
record. I'm sorry, I can't be more specific. You may be able to pull it up in the electronic version, but I don't know who noted that.
All right,
Oh my gosh.
let's move on.
This will get awkward.
The rest of your report, it shows that the child, Jameson, was up to date on immunizations, right?
Correct.
I could use
So
some
his
emotional
parents are
support
taking him in
vodka.
for his doctor appointments as scheduled, right?
I assume so, yes.
There's no evidence that they're trying to avoid taking him to the doctor or trying to avoid getting him medical treatment for anything, right?
Correct.
In fact, the only photographs that apparently exist of the hematological events from November come from my client, Carrie Timms, right?
I believe so.
Is this pretty consistent with your experience in child abuse cases that the
Hate
parents are
him.
bringing the child to the doctor multiple times?
Now,
I-
he's
I mean,
gonna
I-
say yes.
I imagine you're going to say
Of
yes,
course.
but
He is.
they're bringing the
Yeah.
the patient in and that they are the ones
God,
providing
I
the
hate
photographs
him so
that you are then
much.
trying to use as evidence against them?
Oh my
Oh,
gosh.
he's rolling his eyes.
So
Oh,
She
you-
worded that so beautifully.
Look at this. Look at this glasses move. He's so uncomfortable. Watch him take the glasses off and how he like
can't even put 'em down.
literally drops them. This is so bizarre.
I imagine you're going to say yes, but they're bringing the patient in
He
and
nods
that
in
they are the
agreement,
ones providing
yes.
the photographs that you are then trying to use as evidence against them?
Yeah.
So it's not uncommon.
Did I just
for-
hear the jury laughing?
You know,
Did I just hear a laughter in the jury?
Maybe.
Or the gallery? Listen closely. Someone laughed, unless it was one of you, and it was, I heard it through my, listen
Trying
to
to
this.
use as evidence against them.
So
right there. Did you hear it?
That was the front row. I'm not gonna say names, but that was the front row.
It was a great question, though. So let me get this straight. You're saying, do you often take pictures that parents give you and then use those pictures against them to build a child abuse case? Like, that's basically the question. Like,
wouldn't it have been funny if she said, I mean, you did that with Emma Hernandez when her parents,
yeah,
wouldn't that have been
yeah.
funny if she could have just said that?
That would have
the
been
same
great.
thing. Remember that, sir? We'll see you next month for that trial, but just to get that out there.
Yeah, that would have been great.
I thought you were about to say, see you next Tuesday.
Oh, Carrie drops the C word.
I didn't.
We can check it off.
She,
We can check it off the
spelled
bingo
it.
card.
That's and
She spelled it.
Pastor
I didn't even
Coomer,
spell it.
Pastor Coomer, I didn't even spell it.
She
I just
didn't even spell
I'm
it.
done.
She
I'm
used
done.
the
Whatever.
anagram for
It's
it.
the
I didn't even
euphemism.
know what that meant. I've never heard see you next. I never even heard
Tuesday.
that.
Really?
So I'm like, why would we see him next Tuesday?
You can say "see you next Tuesday." It's not a swear word, but I'm gonna let the bingo count it. And Carrie's gonna have to go to confession, but that's
She's
fine.
eating a lot of
She'll be-
cookies. She's eating a lot of cookies right now.
Your
I
pastor
think
will
I
forgive
see her
you.
neck getting more red.
Or, the caregivers, of course, are going to be the ones typically bringing kids to the hospital when they notice that something's wrong with them, whether it be a fever, a seizure, a bruise. In cases of child abuse, it's not uncommon for the caregiver to be the one who brings them to the hospital. It doesn't mean that that's the person who inflicted the injury. I can't tell you who did that, but it's, whoever identified it.
Isn't he trying to
Could it be
tell
the
us
person
who did
inflicted
it?
the injury? Sure. Could it be somebody else in the household? Sure. Could it be, somebody outside the household? Sure.
You are
So
not a nice person.
whoever brings the child in really doesn't factor into whether or not they were the ones who inflicted that. That is not my role. That is
Did I
the
snort?
investigative
All
part
right,
of this.
fine.
It's my role to diagnose, just like other physicians. So in my experience, I've had
Werther's,
mothers, grandmothers who've admitted
Every
to
time
me
I'm like, who's eating?
harming
And then
their
I'm like,
children,
oh yeah,
they're
it's
the ones who brought them in.
judge.
So absolutely, they can present to medical care because they're seeing their child then with something that they want to address. They want to make sure that this gets fixed. It doesn't mean that they weren't the ones who caused that.
It's a long
some
answer to
Okay,
that question.
prior.
so I was wondering while he was going through that, like, why isn't she objecting and saying,
Yes.
non-responsive? However, I know why. I know why she didn't. He sounds like such an asshole that she's just like, just let him go. Just let him go because everyone can see he is not answering the question that I asked
She did
him.
that with Brown too, because a couple of times, remember, the judge was like, I'm sorry, was there a question? And Catherine looks and she's kind of like, we'll move on, Your Honor.
The whole time, you can't see her, but the whole time she's
Looking at the jury.
I love her so much.
Yep.
Yeah, she's amazing.
Yeah. I
She
mean,
is a
this,
fantastic
I can't
lawyer.
even remember the question at this point. And I think that this is, and that's why she let him go on because he has completely gone off the rails. So just let him keep going because this is annoying the jury. They know he's not answering the question. And now they're like, where the fuck are we going with this?
Well, what do you mean get fixed? I thought no one even knew about these rib fractures from January 14th until after he was brought into CHOA. Are you saying that they actually would have presented and people would have been aware of the rib fractures before then?
Sure. As I mentioned before, breaking a bone hurts. So I would expect at the time when the ribs got fractured that he would have shown signs of pain. So yes. Now, at moments after that, days after that, weeks after that, you may not be able to.
Like when DFAX was there doing an investigation.
Yeah. Jen, the couch fairy, says some of us had parents who left bruises or other marks from real abuse. Times I went to the doctor, 0, nada, none times. No times. Jen, I'm really sorry about that. I'm sorry that happened to you. That should happen to no children. But you're right. And I've heard from other people who were abused as children, their parents didn't take them to the doctor to say, look what I did to my kid, and why is my kid in pain either. So most of the time, children who are being physically abused at home, their parents are not taking them to the doctor. Like they're getting looked at, they're getting seen by teachers, and they're getting asked, why do you have bruises on you? In fact, one of the girls I interviewed in the What the Hales case, who was the stepchild of Lynette Preston, who got taken away by DCF in another state, Iowa, Idaho. It's one of the I states. Anyway, she had been hiding bruises all over herself for, months. And she just happened to take her shirt off to change into gym clothes. And her best friend saw a huge bruise on her back and made her tell her how she got that. And then she took her to the principal, and the principal called DCF. And they also called Lynette, which was really stupid, because then it got way worse for her at home, according to Ashley. So that's how bruises for abuse usually get found out, by accident, by a third party. It's not the parents taking them to the doctor and being like, look at this huge bruise. Where did this come from?
I just sent you the email, 2 emails, and
okay.
There's images of Jameson lying on what you can clearly see is a hospital bed with like the blue color sheet.
Yeah.
And then his dad is holding him so I can take photos, because I took photos of everything. But the date on those is November 19th at 4:38 p.m. Now, if you'll look at the wrist on one of those, that was taken on November 20th at 11:08 a.m. So within 24 hours.
All right, which one was?
So that was the last one. So that was taken on the 20th. That right there, you can see the timestamp.
Okay.
Well, it says yesterday. Hold on. Yesterday would have been the 19th. So the next one is the 20th.
So this was on November 19th, and then this one was taken on the 20th, and there's nothing there.
Yeah. And then I sent you the.
There's I can still see actually like a tiny. Right here, I can see a tiny.
But that's less than
remainder.
24 hours, and then you can see the one.
That's crazy.
Down his legs is the craziest. Long bones, and in the bend of your arm. That's where all your tendons would meet, right there. So it's where all the connective tissue is. So if you look at the long bones, same situation.
Isn't that interesting? Yeah, that's really bizarre.
Who's ever had a bruise of that darkness knows that doesn't go away that fast. Like
the one on the knee is worse.
All right, hold on. I'm gonna pull that up.
Not
okay.
Go away.
Oh my gosh, Carrie! I would have been.
Hours.
I would have been terrified about this.
I woke Brady up screaming. He thought someone had broken into the house. When I was changing his diaper and I saw that, I screamed, absolutely screamed. And he had one that was like a straight leg, straight down his knee.
Holy cow!
But look how marbled his skin is at the same time.
Mm-hmm. Oh my God, I would have been terrified. How do you
make that? How do you make that mark? And when we rushed him,
yeah.
How long did the leg bruises last?
So,
oh yeah, look, he's mottled all over. Look at his belly in this picture.
Yes.
So he's so cute. Look at that little mouth.
Look at this one, Megan. It's insane. It might take it a second to come through as well.
Poor baby. And they
shows you how many
of these pictures. These pictures would have been very upsetting for a jury if they believed they came from abuse. So why the heck didn't they use them?
Yes.
Seriously, I feel like if you're trying to claim the parents like abuse their child. You're using these because these are
Yeah, these are way better pictures to be like, oh,
these are horrific.
Because you can't see the fractures in the X-rays. You can't with the naked
because there's
eye,
no
you can't
fracture.
see
Yeah.
that.
Yeah, this is like, ooh, the baby is in, but then to like show the next day and be like, they're clearing. That is not a bruise.
That's not
like we would that's not a bruise from being hit.
No, that's something else.
You don't have to be a doctor to understand a bruise like that doesn't go away quickly.
Tell me how this supposedly happened in his ribs, right? None of that is on his torso.
All right, hold on. I'm looking. You sent me something else. What else?
That
do we
shows you
have?
how
Oh
mottled
my
his skin is.
God! Oh my God! Hold on. Look at his poor little skin. Can you see? Maybe I need to pull in on this because it's here. Let me zoom in.
I was terrified, y'all.
Look at that.
How would you do that abusively? What mechanism? What would you do? They knew this baby had a problem.
Look at his legs. Oh, and look in this one on the. Okay, look to the left. You can clearly see, and that's where that mark is that was really pronounced.
Yeah.
It's in the same vascular pattern.
It looks like his blood vessels. It's like
it looks like his vessel.
That's exactly what it is, and that's exactly what our expert testifies to whenever we get to that. But imagine seeing that on your child.
God, Carrie, I'd be terrified.
And that's why I'm so ill that it got to this point, because I saw that and I thought I was going to lose my baby, and then I did lose my baby. So that is, I mean, for them not to even use these.
Yeah,
that's exculpatory evidence that they had that they could have used. That's exculpatory, in my opinion.
Of course it is.
Agreed.
Of course it is. You can see from this picture, especially, that this is not this is not from hitting. Look you can see his little vascular structure. You can see it through his skin, and it matches exactly to the markings that are dark red over here on the left. Like those are veins
all over his little cheeks, his head,
and on his head, and on his head, and on his arms. Oh my God! And there's a bruise on his elbow here. See? Like a dark mark on the elbow right by that same vein right there. For God's sake, why are they? I'm not a doctorologist, and I'm looking at this going, that's a problem, a medical problem. Duh.
How terrifying is it that came up
people.
And the first thing that they do, first they send them home after Erlanger. Like, well, there's nothing here.
Don't forget they lost blood.
Yeah.
They lost blood first.
Oh, right. They lost his blood work. Right. Because, yeah.
It's just terrifying, honestly. But
and then we found out yesterday, we found out that he now has to go to a pediatric cardiologist to get his heart checked out. So it's like we could have been 3 years ahead of all of this if this 3 years wouldn't have happened. And if I have Oreo in my teeth, y'all just can make fun of me. I don't care.
No. It's all right. Don't worry. We're going back to small pictures anyway. No one will be able to see.
Because you need to have motion about the fracture for the broken bone to hurt. So at the time of fracture, and then if there's, potentially some, like, if you're holding the baby, maybe, but it's hard to tell with a young infant why they're fussy. They may be hungry. They may have a wet diaper. But at the time of fracture, I would expect.
If you had looked at those pictures, maybe you would have figured it the fuck out, doctor, because those pictures tell a different story. And it's not a story of abuse. Those pictures are very, very clearly a systemic issue going on inside his body. What the hell is wrong with you people? Now I'm angry. I'm so angry at the prosecutor right now. So you can go ahead and check that off your bingo card, because these women should never have brought this case to trial. The prosecutor, whoever the DA is, I wish 1,000 bee stings. I wish 1,000 bee stings on this man. I wish him to have itchy skin all winter.
Absolutely, that whoever was in the vicinity, that you would recognize that baby was in pain.
Okay. And now the aunt and the grandmother did tell you that Jameson was a colicky baby, right?
Mm-hmm.
And I wish for him to get caught at every red light from now until eternity, to be late for every meeting. I mean, I have wishes for this man. Yes, Flux?
My favorite wish to wish upon people is for fiery diarrhea and rush hour traffic.
There we go. I wish that on him too. He should never have brought this case. What a ridiculous and itchy balls too. Yes, I wish him a lifetime supply of itchy balls. I can't believe these people brought this to trial, and the fact that they didn't use those pictures, that we have now seen those pictures,
tells you everything.
I can't believe this. This is worse than I thought. Worse than I thought. Damn. By the way, Mel Klump, thanks for the 2. Says all 4 of you are beautiful. Well, we needed that right now because we're feeling very angry. So I appreciate that. And maybe not says, just tell Carrie that square bullet points should fix her phone problems. Stop spreading your disgusting square bullet points all over the universe. Nobody needs those. Nobody needs those. And Mel Klump, thanks for the 10. Carrie, you're in a wonderful, amazing, and super strong mom. I agree. I agree with that in huge ways. I can't believe that these people did this to you. I mean, I was mad before, but now I'm really angry.
It took more strength, I guess. I mean, obviously the 3 years took a lot of strength, but when that man right there stopped in his tracks to say, "Oh, hey," at the Hernandez trial, and I just stood there, and as a redhead, my attorney was in the room. Catherine Bernard was in the room. So I had a split decision to make. I was like, my attorney's already in the room. But I chose Jesus. And that's that.
Good for you, Carrie. Because I probably would have leaned in closely and said, fuck you. With a smile on my face. So no one on the camera could say that I had done anything wrong.
We're just getting Jen, take it out. Jen, take it out. Edit it.
Right.
Still quite small when you saw him, right?
He was 3 months.
But in terms of his percentile for height and weight.
Oh, I hate this part. I hate this guy. He is the absolute worst.
I don't have his percentile. It's not on this note. So he was about 13 pounds, 13.2 pounds, at 3 months.
Okay. So let me just, and if you could just flip to page 217.
Okay.
And this is your after visit summary that was generated, right?
Yes.
Okay. And does that show the percentile in height and weight for Jameson?
It does.
Okay. And that was
literally how many pages
percentile for weight and sub first percentile for height, right?
Correct.
Because he was a premature baby, right? You were
If this
aware that he was
motherfucker says anything other than
right?
yes.
Oh no, he's not going to say yes. You know what's coming.
I'm going to say yes.
You know what's coming.
Of course. Oh my God. I hate them. I hate them all.
You are not a nice person. I have anxiety over the roof.
So he was 37 weeks.
Did you see that shoulder shrug?
It's not premature.
Significantly premature.
Did you see the shoulder shrug? Watch
So he
again.
was 37 weeks. So I wouldn't say that that's significantly premature. He was 5 pounds, 14 ounces. So no, he's not significantly premature.
Not.
She didn't ask you if he was significantly premature.
Yes,
she
she never said
asked
that.
you, was he premature?
Right.
The answer to that question is yes.
They never asked why. You know, does he know why he was born at 37 weeks? Wouldn't that be a factor into why it's 37 weeks?
Why was it 37 weeks?
I was losing significant amounts of fluid because EDS. I didn't know it was EDS at the time. And they had to do multiple ultrasounds every day. I went in on a Wednesday, had them on a Friday, and they had to keep doing ultrasounds. And every time
measuring
they did
the fluid,
losing. So they had to forcibly take him because I was losing fluid, but that's not significant, guys. It's not.
Yeah. Not okay. For fuck's sake, you're right. Every space on the bingo card should just be for fuck's sake at this point.
Seriously.
Go ahead. Oh, I got bingo. Yay! I finally got a bingo. All right, for fuck's sake, definitely gets checked off the bingo card list. Oh my God, this guy.
But premature?
I mean, 37 weeks is, we wouldn't consider that to be
shut up.
Premature. It's above 36 weeks, so no.
So it's 36 weeks premature, not 38?
37. So he was 37. 36 he would consider premature, but not 37. Give me a fucking break.
Every
If
week
my
is
kid
so
was-
important to a baby's growth.
Every
week
week.
is important.
Every week. They tell you all the time, you need to get to that 40 weeks. They don't care if you're 41 weeks. They don't care if you're 42 weeks, but they do care if you're 37. They want you to get to 40. So if you go in at 37 weeks because you're having contractions or whatever, they most likely are like, they're hoping it'll stop and send you back home. It's not like they're going to be all amped up to deliver a baby that's several weeks early. That's almost a month early. 37 weeks early is 3 weeks early. That's an entire month. Just shut the front door, you absolute clown. I cannot with this. Don't you tell a room full of mothers what premature is. Don't you tell me, you, a man who's never had a baby, how my body works. Stop mansplaining to me. Is this gay-splaining? I don't know what this is, but I don't like it. Stop telling me. I know how long my baby needs to cook, and it needs to cook longer than 37 weeks.
And we don't contract to export the child.
Yeah,
so
no.
we don't do that.
There's no squunching. There's no squunching involved in labor, according to this guy.
It's even worse because not only is he a man, he doesn't even do anything around female anatomy. So like,
what do you know about this?
A woman that he can bounce shit off of.
Yeah, right. Hasn't witnessed his wife giving birth. As far as I know, not a dad.
He's not down there,
not a
having his
gynecologist
business with fun or whatever, but
or a gynecologist, not a medical gynecologist. Didn't even perform abortions, as far as I know. Like, this guy does not seem to have any interest or knowledge in that region.
He is BFFs with a sexologist who is female, though.
But has she had any kids? She doesn't look like
yes.
She does. She's had children. That surprises me because normally these child abuse pediatricians don't. That's unusual for the child abuse pediatrician, actually. Well, I'm glad she's had kids because maybe she can explain why there's no squunching in birth, according to this guy. I would like to hear her explanation of that.
All right. Now, we've already talked about some of the test results that you had back as of February 3rd, 2022. That did not
Jen the Couch Fairy, thank you for pointing that out. He doesn't even treat babies as a pediatrician. This guy isn't even a real pediatrician. Nobody brings their babies to him when they're sick. He does not diagnose sick babies. The only babies he sees are the ones that Verena Brown says are abused. So that's all he's looking for. He's not healing babies. This guy is a fake pediatrician. He doesn't help babies get better. He only helps get them out of their homes.
Genetic testing results, right?
That's correct.
When did you become aware of the genetic testing results?
When they resulted, which was probably a few weeks later.
Okay. So what actions did you take when you received the
I got the results when they resulted? Is that what you just said?
Yes,
Yeah.
he's such a smart aleck. When they resulted.
He did.
I got the results
when they resulted.
Can we, instead of rent a cop, can we?
Later.
Well, no, wait. No, he was restating her question. To be fair, he was like, wait, when they resulted? I think it was a few weeks later.
Oh.
So he didn't say when they resulted. He was like, when they resulted? Okay,
Well, he needs to work on that tone.
Okay.
Yeah.
So
He
what
does. It's
actions
still
did you
catty,
take when you
ratty.
received the genetic testing results?
Nothing. We did nothing.
Didn't do nothing.
But I'm not certain if, since this was Dr. Brown's case initially, if she
I need
handled
Elon
that,
here.
if I did. But we reviewed the results, saw that there was this variant of unknown significance. No, it was Dr. Brown because she had recommended
Ceiling cats. I should have
genetic,
had that on the bingo card. He keeps looking to the
genetic
ceiling cats for the
follow-up.
answers.
She referred them to genetics. They did not come to that appointment. They were then seen by another geneticist.
Thank you, chat, for catching that. Unknown significance may be checked off the bingo card.
So that was the follow-up that was done there.
Okay, so the answer is you didn't do anything with the genetic testing results that were received a few weeks later?
They were being handled by Dr. Brown. That's correct.
So did you have any further involvement in Jameson's case after February 3rd, 2022?
No, he has a bunch of straight
No,
liberal
not
white
until,
women friends.
Probably.
Recently.
And they're all
I know
named
that Dr.
Karen.
Brown saw him again in follow-up clinic when he was about 8 months old. But I did not have any further involvement, no.
Okay, so when you say you had involvement recently, what involvement are you referring to?
This. So preparing for this trial.
Didn't prepare well, sir.
All right, so some of the test results
even a little
were
bit.
back on January 13th, 2022 at 6:45 p.m., right? And I'm looking at page 198 in the record of that.
Okay, yes.
So, and then there's another column of results that
pause
didn't
this
come
with
back
this
until
guy.
January 15th at 8:33 a.m., right?
Sure, so that was additional labs. Yep, they were drawn on a different day.
Which that's where you got the vitamin D total. You didn't get the vitamin D total until January 15th, 2022, right?
That's correct.
So at the time, the diagnosis of non-accidental injury was made by someone. There was no vitamin D test result back at all.
That's correct. It's a different day, yeah.
And how about the factor 8 and factor 9 assay results?
Mm-hmm.
Those were also not back until, I believe, the January 14th at 1 p.m.
Correct.
And that's the one that showed a high reading on the factor 8 assay, right?
Correct.
But you did have the lipase results back. You talked about that with Ms. Fox, the low lipase, that was back on January 13th, right?
That's correct.
And that indicates that there was no trauma to the pancreas area because you would have expected elevated lipase levels had there been trauma to that area, right?
Well, at the time that the lab was drawn, so your lipase is going to, if you have injury to the pancreas, it's going to go up. It'll stay elevated, kind of peak about 48 hours, and then it'll decrease back down over 1 to 2 weeks. So at the time that the lab was drawn, it was normal or low, yeah.
Okay. Well, I mean, was it normal or was it low?
Yeah, so it's low. It's at 27, which really doesn't have much significance. The factor 8, as you mentioned, was high, which is not indicate that there's any type of bleeding disorder. All the bleeding labs were normal. If you have a very low factor 9 or factor 8, that would be consistent with not having enough of that factor to cause the clotting. So having it high is actually, it's not a problem. And having a low lipase, that really doesn't indicate that there's any problem with the pancreas.
Right. It indicates that there's not a problem with
Correct.
the pancreas,
Yeah.
right?
Yeah. I don't
So-
believe I stated there was.
Where is the T10 vertebrae in relation to the pancreas?
So
Chat reminded me I need to stand up for a little while, so I'm adjusting the stand-up desk.
So you have 12 sets of ribs, generally. Some people have 13, some have 11. So It's at the lower end where your ribs come around. So 2 up would be where T10 is. The pancreas
stuck in my cord
would be anterior to the vertebral body in the retroperitoneal space, but it kind of goes over the vertebral bodies. It would be, I would say, we'd have to look, like say if we had a CT scan or something.
So you don't
exactly
know.
So he doesn't know.
It would be in general around that area.
He just
general in
I like
this area.
Wait,
I like how he threw out a bunch of words that most people don't know. And
Word
it's
salad.
the vertebral, that was the worst explanation of where is the pancreas I've ever heard.
So if you listen to him, he says that the lipase levels should have been elevated and that would peak around 48 hours and then slowly decrease after a couple of weeks. Okay. If you look at our indictment, according to all the hard work Detective Faulkner did, we allegedly did this between the 10th and the 12th, which would have been, on the 13th and 14th, whenever we were at the hospital, that should have been elevated, no? Do you follow that, Jennifer? I mean, so it's all like contra, and it just pisses me off. Sorry.
Yeah, I definitely understand. This guy is an absolute douche. I'm sorry.
And I'm glad you mentioned the CT scan, because an X-ray does not show you everything you need to see with a small compression fracture, right? You generally need to get an MRI to determine what exactly is going on.
Not necessarily. I defer to the radiologist on that, but if they're calling it a compression fracture on the plain films, and then you see it progress over time on a follow-up film, then it's real. So in some cases, we'll have a CT scan, which is
Puzzler, thanks to the 10 ladies. Don't hold back. Let us know how you really feel. Someone please take those glasses off of his and radically disassemble them and then calmly hand them back. I would love to see that. God, that would be funny. I have to back up because the CT scan question, oh my God. We need to back up and get that whole question. Because this is what we were talking about with the MRI.
And I'm glad you mentioned the CT scan, because an X-ray does not show you everything you need to see with a small compression fracture, right? You generally need to get an MRI to determine what exactly is going on.
not necessarily.
Not necessarily.
I defer to the radiologist on that, but if they're calling it a compression fracture on the plain films, and then you see it progress over time on a follow-up film, then it's real. So in some cases, we'll have a CT scan, which is just different types of X-rays. It's instead of going kind of straight through the body, we're kind of doing cross-sectional imaging. But I mean, I have confidence in our radiologists. They're all pediatric radiologists, and if they identify it on the plain films, then I have no reason to not agree with that.
Well,
yeah,
and you mentioned, I believe, fairly early in your testimony to Ms. Fox, that there can be some very subtle fractures that are missed on a first scan. Is that right?
That's correct.
Okay.
And that's why we get the follow-up skeletal survey, yes.
Now, was there any displacement with these rib fractures?
No, so they were already healing. So you saw this callus about them, so a lump of new bone that was about the fractures.
Was there anything unusual to you about the size of that healing callus or its appearance on the scans?
No.
I'm still here, but I've changed my avatar to suit the witness.
I know we're coming up on the lunch hour, so I'm wrapping up here, Doctor.
That's my thought the whole time.
But just to be clear, you have offered some opinions with a lot of confidence about whether or not a genetic variant of unknown significance is actually pathogenic or not, right?
Right back.
For Jameson, yes, I did. That's correct.
Okay. And you've offered some opinions about the only way that rib fractures and a purported compression fracture might have occurred, right?
I don't know if it was the only way, but I did testify to manners in which you get those fractures, yes.
Okay. And I believe you have also testified regarding some lab levels and whether or not those have any relevance or significance as to a possible connective tissue disorder that Jameson could have.
Which labs are you speaking to specifically?
I mean, I think you have offered some testimony. We just talked about lipase and the relevance of high and low levels, factor 8, factor 9, vitamin D levels, et cetera.
Yeah, so those don't have anything to do with the connective tissues.
Your position is that vitamin D has nothing to do with connective tissues?
Vitamin D is incorporated into the matrix, but
Look at the eye rolling.
The vitamin D level absolutely was normal, 32.
You can check off muted boomer because I was muted when I was making commentary there. Go ahead and check that off. On the bingo card, that was me.
Lipase, like I said, is an enzyme that's produced by the pancreas.
No, wait a minute. Carrie, he just said that the vitamin D level was normal. Was that always the case? I thought there was a low vitamin D level at some point.
So this is what is explained, and you'll hear it later on in testimony. Just because your vitamin D is low at the time of draw does not mean he has not had a low vitamin D, which contributed to bone malabsorption or bone abnormalities in the past. So at the time of this drawing, it appeared to be normal, but because we weren't testing his vitamin D from the time he was born, so how can you definitively say? It's kind of like a variant of unknown significance. How do you know? We didn't have all these, so you'll x-ray the hell out of a child repeatedly, but you won't redraw the vitamin D.
We won't redraw the vitamin. So they never did like regular vitamin D testing.
Not that I'm aware of.
So there was no way to find out. Mm-hmm. Now, I may be getting your case mixed up with the Hernandez case because I do believe that the Hernandez case, there was low vitamin D. Is that right, Jen?
Yes, and it's going to be so interesting when you see CHOA people take the stand at their trial versus here, how they will bend the numbers to fit their narrative. Because really the level is 30 for CHOA. Their standard is if it's below 30, you're deficient. Well, so Jameson's at 32. That's still on the low end. That's not that's not a high number. Emma's was 15. But they find a way on stand to talk about how that's actually not low. It's not deficient.
It's not that bad. Like it's not right. That's always what they say.
It's odd because like for me, I've had low vitamin D and they're like, ooh, you're like it was way low. But even when you're like in that 30 whatever range,
It's
they're like,
still
ooh,
on
you're
the
really
low
low. We
end.
need to boost you up. It's not like, oh, you're still good because you're above 30. Like you still need to get above that number to be like normal.
The last rebuttal witness in the Hernandez trial is the biggest jerk. You will hate her. They brought in a rebuttal witness and Taki's attorney, Steve, does an amazing job and has a printout of what CHOA's standards are and like hands it to her and is like, by your own standards, her level was low. So it doesn't matter, guys, what the number is. They find a way to spin it and try and look at the jury like we're stupid for asking this. Here's what it really means by just mumbo jumbo.
Natalie Fleming has discovered, by the way, what's wrong with your phone, Carrie. This is what's wrong with your phone, apparently.
I knew it. Oh, God.
It's possessed by a demon, and there's also a frog possibly in it. We're not sure, but this is Natalie Fleming's rendition.
That's terrifying.
Of the demonic electronics. That's funny, Natalie. Good one.
So those were in the other labs. Everything was normal.
Okay. So is it your position that if Jameson had been brought in at some time between December 9th, 2021 and January 13th, 2022, that you would have seen elevated lipase levels given that there are alleged fractures right by the pancreas? At some point, would the lipase levels have been elevated, or would they just always have been low or normal?
There's no way to tell, but when we see pancreatic injury, it's from blunt force trauma to the abdomen. So you're squishing the pancreas
Or
onto
squunching,
the,
if you will.
to the bone. So having an axial load to your vertebral column, it wouldn't provide that. You'd have to have something that kind of squishes the pancreas and then causes it to release all of that lipase. So
He's doing physical representations of what happened here.
The vertebral compression fracture and then the posterior rib fractures, it wouldn't come from that type of force. You'd need to have something that actually pushes the pancreas towards the back of the body and kind of impinges it. We see this in kids who are like riding on a bicycle and then the handlebars like come into their abdomen. We see this from kids who are stomped on their abdomen. We don't see it from like the axial load, which is that like stepping down on the cans and crunching them. That wouldn't put any kind of force onto the pancreas. So I wouldn't expect you to have any abnormalities with the lipase at the time of the injury, but you need to check the lab because we're always making sure that we're looking for other signs of injury.
Holy cow!
And your position, and
Carrie's fundraiser just got an $1,000 anonymous donation 40 minutes ago.
I think we were at 68. I mistyped, so I think it's at 68%.
It says 58%.
Is
now.
it?
Holy shit!
Thank you, whoever you were. Thank you.
$1,000 anonymous donation. Thank you so much, you guys. That is amazing. We're going to get them 100% funded, and there will be some hilarious river dancing. I assure you that is going to happen. That was so generous. Thank you so much, whoever did that.
I want to make sure I understand you correctly, is that someone could theoretically squeeze a child so hard that they fracture the child's ribs, but there's no injury to internal organs whatsoever.
Oh, sure. Because we routinely check these, what we call trauma labs, which are checking the liver enzymes, the pancreatic enzymes, and I've seen countless times where there are rib fractures. We know there are fractures on the x-rays, and those labs are normal. So you can absolutely have that type of force on the chest without any kind of injury to those internal organs.
Okay. And your position is that that the birth process does not involve this level of pushing and force and could not cause these things.
So as I stated earlier, you can get rib fractures from birth trauma. It's exceedingly rare, but it can occur. We know that that is not the case for Jameson because we didn't see any rib fractures on those first two sets of x-rays. So the timing.
But aren't you the same dumbass who said we can often not see these injuries? And so we often have to retake them so that we can see them later at a later time. God.
Yeah, he said that.
The compression fracture I mentioned is a compression. It wouldn't be like pushing down on the baby during the birthing process. So I can't envision a scenario where you would get a compression fracture of a
you can't?
vertebral body during the birthing process.
Okay. Now you mentioned earlier that babies are capable of experiencing pain, which seems like it should be a pretty non-controversial opinion, right?
Correct.
When did your profession determine that babies were capable of experiencing pain?
I love this part. Catherine, get him. Get him.
My profession? Yes. I have no idea. I would imagine that humanity has known that since the dawn of time. Because when you interact with babies, if you're doing something that's painful, they're going to be crying out. So I don't know if it's anything specific to pediatrics.
Okay, we'll see about that.
Specifically, when did pediatricians start anesthetizing babies before performing surgery on them?
Oh, Catherine for the win.
I don't know.
Her.
Okay.
I would,
look at her face.
I think it was more or less than 50 years ago.
I don't know, and I don't know.
I love when she looks at the jury.
Judge like a good
Oh, look at that! Look at the jury.
Litmus test about when pediatric anesthesiologists or surgeons determined when children can experience pain. I think that I think that that's
yes,
a flawed analogy to say that.
Is it though?
If it's on this date, we started anesthetizing children. Prior to that, we didn't think that they experienced pain. It's probably more due to the fact that at that point in time, they're able to do.
There was a time in American medical history when doctors prescribed lobotomies for personality disorders. There was a time in American medical science where they put leeches on our skin to bleed us because they thought there were bad humors inside. I love this line of questioning, which is,
remember,
when did your profession start anesthetizing babies?
Remember when they had cocaine for migraine medication?
That's right. They were prescribing cocaine, which frankly, maybe they should go back to doing. I mean, make Coca-Cola great again, really. But still, why the hell? It's really funny that we put so much trust, right, in medical science. And these are the same people that 50 years ago were lobotomizing Rose Kennedy. Literally, like that happened. Maybe it was 60 years, but not too long ago, they were shoving ice picks in the eyes of bad girls to make them stop going out with guys at night. Let's just shall we not forget?
Do it safely and to make sure that these children are anesthetized properly.
Right. And diagnosing women with hysteria. And the only cure was for a weirdo doctor to give them an orgasm. Yeah, you heard that right. So let us not put our faith into medical science, shall we?
As opposed to
look at Catherine's face.
The need for it, because they're obviously, if they're anesthetizing, we're anesthetizing them to.
She's just letting
minimize
them go.
or eliminate the pain. So I had to get to a point where they're performing those surgeries, and they're like, we really need to be making sure these babies aren't.
Oh my God,
what
that
can we
face
do to
she's
make sure
making
that they're
right
not?
now, that is the same face my mother would make at me when I was giving her some bullshit excuse about something. It is the exact same face.
I was going to say, I love that
Carrie's doing it right now. Carrie, it's amazing. Yeah, keep going.
I love that she's meeting him on his level, but it's just so much better.
I love that the cameraman is focused on her face. Her face is so good right now.
Experiencing the pain doesn't mean that they didn't have knowledge that they experienced pain prior to that.
Wait, let me stop you right there.
Yes, Your Honor. Thank you very much. And good afternoon, Dr. Messner. I believe we were.
Right, so then they took lunch, and now they came back. They came back from lunch, and you would think that Catherine would move on to something else, but that's not.
Oh no! Oh no!
That's what Stephen hoped.
That's what he was hoping, that was like the judge came in just like a Saved by the Bell moment where he could just get out of there and come back to a new question. No, we're going right back to that question.
I feel like he immediately Googled what year did we start using anesthesia on infants, just in case.
Although he claims that he didn't. That's what's funny.
Discussing when doctors decided it was important to start giving babies anesthesia before surgery, right?
That's correct.
And did you come up with any kind of estimate about when you might know that happened?
No, not. I haven't done any research since we discussed it. I believe you mentioned something about 50 years ago, but no.
I'm going to ask Rock.
Okay. But do you feel confident in all of the conclusions and assessments that you've made here today to this jury?
I do, yes.
Okay. And that's based on your training and experience working at Children's Hospital since I think you said 2009, was it? Or
so I've been at Children's Healthcare of Atlanta since 2007.
2007, apologize. Wonderful. So that's pretty much been your.
The answer is 1850. 18 and what she's getting at, and what she's getting at is that the reason that they did not use it on babies is because there was a myth that babies did not feel pain. And by it took until the 1980s to debunk these myths that infants don't feel pain due to studies.
All the way until the late 1800s? To figure out that babies...
No, 1980s. It took until the
babies feel pain?
80s to debunk the myth that babies don't feel pain. This is what medical science has done for us. It says by the 1980s, studies debunked myths that infants didn't feel pain, leading to more routine and refined use of anesthesia in neonatal care.
But that was only like 40 years ago.
Yeah, that's what she was getting at. She was getting at, which is a great point to make, which is you people don't know a whole lot. Like, you know some things, but you fuck up a lot, don't you? Like, including things that we should know. And what's interesting is that he said, all of humanity knows this. We've known it from the dawn of time. Yeah. That's actually not true. The American Academy of Pediatrics, sir, did not know this until the 1980s, apparently. What? They were doing surgeries on babies with no anesthesia. And by the way, I think
you can't tell me they don't
still
torture
do that.
babies. Hospitals.
They only dose babies with Tylenol when they're doing what do you call it? When they're taking off the thing. What is it called?
They dose them with Tylenol after they take them from parents. They don't dose them with anything until they take them away from the parents. The baby's crying because it misses his parents. Then they dose them with Tylenol.
Yeah, and they dose them with Tylenol when they do. They didn't give my son anything when they did his, what do they call that thing?
Circumcision?
Yes, thank you. A circumcision.
Oh.
They don't do anything for that. They don't do it. They don't give him anything for that. And if I had known, if I had known about that surgery, I would never have had it done, ever.
Thanks, Dr. Sarah Harbin Picket. You abused my son the first time.
Yeah, and then they give him Tylenol, which gives him the tism, apparently. So, we don't know. I mean, it's just, I don't know what they're doing. And neither do they.
Career has been at Children's Hospital of Atlanta.
So, and 3 years before that at University of Florida.
Okay. And you've been in the field, the child abuse specialty field since then, right?
Correct. Since 2004.
Okay. And were you able to think of any examples where one of your colleagues had already found a non-accidental injury diagnosis and you went back and said, no, that was wrong?
No.
Okay. And then are you familiar with the Department of Human Services and Family and Children's Services new protocol about child maltreatment cases as of February 14th of 2025?
So I'm not familiar about a protocol, but I am familiar about a change in like a attestation, if that's what you're referring to.
Okay. Well, and so it's a memorandum about medically diagnosed child maltreatment assessments, which you would agree that this is a case of a medically diagnosed child maltreatment issue, right?
That's correct.
You don't have any external evidence whatsoever suggesting any kinds of acts of child abuse. You're just trying to discern what might have happened from the medical records, right?
Well, it wasn't from the medical. There was a medical assessment done, a medical workup, if that's what you're referring to.
Yeah, okay, this is not that hard of a question. Was this child diagnosed with abuse just through your medical assessment? Like, was there anything? We know the investigator didn't talk to anybody but doctors, so he didn't come up with any evidence that was outside the hospital realm. And the DCF worker said everything was fine. Their investigator said everything was fine. So it wasn't from her. You didn't get any information about abuse from her. Where did you get this information from abuse? Oh, what are you saying? There was a medical workup. Yeah, and that was the only thing, right? He can't even answer that question.
Actually, wasn't just based on the medical records.
Yes, it was. Yes, it was just based on Dr. Brown's medical records specifically. Her records specifically are the only thing in this case that I have been able to discern was used as any evidence that this baby was abused. We don't have a police report. We don't have a police investigation. We don't have a DCF investigation. We have nothing other than this one doctor's report, Dr. Brown. And then this guy who came along to rubber stamp it. Yep, that's abuse. That's it. That's all we have.
Based on everything that I discussed. So the history that was obtained, the examination of Jameson when he was in the hospital, all of the workup that was done when he was in the hospital.
But would you agree this is a case of medically diagnosed child maltreatment?
Yes, as I stated earlier, yes.
Okay.
Yeah. So
And
yes.
So
the answer, yes. The answer is not. We didn't know. It wasn't the entire. It's medically diagnosed child abuse. Just say it. Yes. Why did he go through all of that just to say yes?
Memorandum says that DFAC staff who serve as liaisons at Children's Healthcare of Atlanta must be notified immediately about the cases and involved in all case activity while the child is being treated, right?
I don't know the language exactly, but if that's what you're stating, yes. And they are there. They're present for our consults. And in this case, it was one
A
of the
lot of
liaisons.
wiggle, itch,
Dr.
cough
Brown had that
happening here.
documented in her note.
I forgot to put that on the bingo
And have you completed one of the medical attestation statements about thoroughly reviewing Jameson Timms' medical history, including but not limited to past medical and surgical history, previous diagnoses and treatments, medication history and allergies, laboratory and imaging results, specialist and consultant reports, and hospitalization and procedure records?
Yikes.
So I did my clinic visit back in 2022. This just came out Valentine's Day of this year. So no, I did not.
Would you have any problem with signing a medical attestation form now regarding your diagnoses?
So the language in the medical attestation that's been provided by DFACS is under review by our legal department, and they've advised us to not sign it at current.
Oh, really?
State that it's in.
Oh.
But all of the
You refused to
by
sign?
the way, can I just say who wrote the attestation? Was it the legislature?
I forget the guy's name. No, it's somebody within DHS, and Candace prompted it to happen. I forget the dude's name.
So
Robert.
someone within DHS
Yes.
wrote this, and they are being told, these guys are being told by their lawyers. And who would those lawyers be? Do they work at CHOA?
Yeah. Yes, they're CHOA legal
So
department.
CHOA attorneys are telling them not to sign it.
And Candace Brose has been informed of this. We have let her know the day that this happened. We turned around and we emailed her and we let her know, hey, the awesome protocol you put into place is being ignored. And then we let her know when it gets asked in the Hernandez trial. And I let her know again last week as a reminder, like, Candace, they're not doing it.
Lon
doing it.
Roberts. Lon Roberts, Deputy
Lon
Commissioner
Roberts.
of Child Welfare.
So what happens if they just ignore the DHS?
I guess they get to just do that, which really all that needs to happen, Megan, the wording in there, instead of like all records, it needs to say all available. We just need to add the word available, because their claim is it's impossible for us to look at everything. We can't, remember Brown, we can't trust who's sending us the documents. We don't know if they're sending us. So all they have to do is put available.
What he will say, though, is that there could be records from other hospitals that we can't get. It's like, yes, you can.
Yes, you can.
You can absolutely. You're DHS. You work for the state. You can get medical records wherever he's been seen. You can get his entire medical record. His pediatrician should have his entire medical record, because you can't go see a specialist without getting a referral from the pediatric person. So there is no reason why his entire medical record shouldn't be totally available to these people. And you're right. Put the word available in there. And
That's
then
what we've asked Candace. Candace, just put the word available in so that they can no longer claim it's impossible to see everything. Then they can just say whatever is available, we've looked at it. So it's annoying. She's ignored us.
DHS also needs to add a consequence if they don't sign it. There needs to be a consequence. Yes. There needs it's not enough to be like, here, sign this paper. we need a consequence if you don't.
Exactly.
And that's the only way that they're gonna be forced to do it. Oh, and by the way, if you missed it, what this attestation is basically just saying I'm the child abuse pediatrician. I have looked at all this child's medical records, and I've taken into account his history, all the medical records into my finding. That's it. That's all it is. I have to fix my camera. It's
just
bright
a little
now.
bit of accountability, and they don't like it. They don't
like that.
Facts about how we come to our medical diagnosis is contained within our note.
Okay, so the answer is no, you would not be comfortable signing a medical attestation form saying that you have thoroughly reviewed Jameson Timms' complete medical history, not limited to medical, surgical, diagnoses, treatments, et cetera, and that you have considered all that information in your medical decision-making for the patient?
So what I said was that our legal department has advised us to not sign the current language that's in this attestation that just came out.
For nefarious purposes, we're sure.
The language is specific to the children who are seen at Children's Healthcare of Atlanta. It also,
that's true. They don't like that.
The way that it's written, I don't have it here in front of me, but
they don't like that it's specifically geared towards CHOA.
This was written for child abuse pediatricians at CHOA.
Oh, you mean no other child abuse pediatricians in the state have to sign this thing?
No, there's only one.
They should all have to.
There's only one other one in Macon.
Well, they should all have to sign.
I mean,
they
I
should
agree.
all have to do it. Why is it just CHOA? I agree with him. Actually, I agree with him.
It's funny that
here.
it's just CHOA.
It is funny that it's just
It's
CHOA.
funny. It's like you guys fuck up so bad, you have to sign this shit.
But I kind of agree with him with the lawyers on this one, where they would have a case to say it's discriminatory or something.
Sure.
So she should make it for every child abuse pediatrician in the state. Just
hey, maybe we
everybody.
need an email campaign to Candace. I just thought of that. Maybe we need like an email campaign to say, hey, Candace, we need to change the language in this letter that you've written.
And also make it blanket the whole state. Make every child abuse pediatrician do it. Do these people work for DHS?
In my opinion, 1000% yes. They are contracted through the state. We cannot get our hands on that. But
well, if they're contracted through the state, then they have no right to say no to the state, saying, here's the restrictions we put on you.
Yeah.
So, duh.
Mm-hmm.
But that's a double-edged sword because they're employed by Children's Healthcare of Atlanta, so they also have to adhere by their lawyers.
Yeah, well, we need to. It's a conflict of interest. They can't work for both. They can't work, and that's what happened in the Maya Kowalski case, and why Sally Smith was able to be sued, was because she acted in two different roles, one for the state and one for Johns Hopkins, and you could separate those roles because she represented herself as a Johns Hopkins employee, not DHS. Right. So she didn't. When she came in, she said she was part of the child protection team at Johns Hopkins, and she was wearing a Johns Hopkins ID badge. That means you work for Johns Hopkins, whether or not you work for the state also. And that creates a real big problem between who do we sue when this doctor hurts us.
It's like Barbara Knox, we know for a fact, when problems were brought up against her at Wolfson's in Florida, Wolfson's was able to say, oh, she just has privileges here. She's not an employee of our hospital. It's like, who is employing her, though? It's the state of Florida. So it's the same with CHOA doctors.
Sorry, Boosh, you're right. He says, Megan, please, it's John's Drops Kids. Right. Sorry. John's Drops Kids. That's correct. I'm sorry. I screwed that up. Sometimes I refer to it as John Shopkins. Because they were very obsessed with Shopkins there.
And Your Honor, if I could approach and
okay,
certainly, Ms. Bernard.
Or I can read it to the jury.
Oh, you can read.
So it says patient information.
You can read.
Name, date of birth, medical record number, if applicable.
That's not what she wanted you to read,
full legal name,
dumbass.
healthcare facility name, department or specialty, direct contact information. Let me see if this is the correct thing. Okay, then it says, attestation statement, I, the physician's full name, attest that I have thoroughly reviewed the medical history of patient's name, including but not limited to past medical and surgical history, previous diagnoses and treatments, medication history and allergies, laboratory and imaging results, specialist and consult reports, and hospitalization and procedure records. I confirm that I have considered this information in my medical decision-making and diagnosis for the patient. And it has physician certification. I certify that the above information is true and accurate to the best of my knowledge, physician signature. So when
and they won't sign
we were presented with this, brought it to our legal department, they were not comfortable with the language.
They were not comfortable with the language. I would just like to point out
language. That's like standard. I think this kid's been abused. There it is. There is no language out there.
They don't want to take any. They don't want to take any responsibility.
Yes.
I'm happy to report that I have reached at least medium wage today, and so we will turn off the commercials for now. If it goes down, I'll have to turn them back on. But for now, we're commercial free. Woohoo! Oh, and by the way, we do have a super tip here that I should play.
It's the wrong. I don't have.
Oh. You don't have that. How did that even happen?
I don't have super tips.
How did that? I don't know how that happened. That's super weird. Why? I know why. I just figured something out. It's because I moved you from the top position. So whoever's in the top position can be here. I just learned. I was wondering how to put another person in this spot because that would be fun to do. And now I just learned it. That's really fun. Awesome. Thank you for helping me teach that. And I totally did that by accident. Okay.
I had
Dan
a really
Davis.
bad joke. I had a really bad joke then, and I'm not.
Oh, that was a really good joke.
I am. So whoever's in the top it knows and does everything, right? So
yes,
Messner.
He's definitely not a top. I'm sorry, but he's definitely a bottom. I'm sorry.
Just more proof that he doesn't know everything.
Dan Davis, thanks for the 5.
I just got here and the bird talk is the first thing I hear.
Thanks, Dan. Appreciate that. Oh.
It's in there right now. It doesn't say that it's like to our like that it's a good faith effort. Because when by signing this, I would be stating that, I had access to all this, that I knew exactly all the records that are out there, that they were all presented to me, which is
were they
really
not
an impossibility. You need to be
He
able
testified
to
that he
go to the
reviewed
other
all of them.
hospital systems, get those records, those sort of things. I feel confident with the methodology that Dr. Brown used in coming to her diagnosis. I feel confident with my diagnosis, that it didn't change the diagnosis when I saw him in clinic. And that's inherent in my note and in my testimony. So whether or not there's, a document that the state has constructed that I'm signing or not, doesn't change my diagnosis.
But you still won't sign the document.
It doesn't matter. Just sign the
As I
fucking
stated
document,
earlier,
sir.
we've been advised by our legal department to not sign this right in its current state. Now, we're going to have additional conversations. This was never discussed with anyone from our hospital system.
No one
I think
needs
that
to
there is,
discuss it with you. This is one of the great things about the jackboot of the state. The state doesn't need to discuss it with you. If you work in any capacity with the state can direct you. They can tell you what to do.
And we need her to do that. We need DHS to push it a little harder.
Yeah, they regulate. By the way, the state regulates all hospitals. If the state says to a hospital, you will now do X, Y, and Z for the safety of the public, they will now do X, Y, and Z, or they will be fined and they will lose their license. It'll happen. What happened to John's Drops kids? They'll get that, those people who come and they find that you're storing the oxygen tanks wrong and that you're not washing your hands before doing heart surgeries on children. And they go, oh yeah, we're yanking your license. You don't get to practice medicine anymore because you're so bad at this. The state completely controls what's happening in the medical industry. So the idea that this guy can be like, well, no one talked to us about it. Sir, it's none of your goddamn business. The state says you're doing something that's wrong and you need to stop and you need to sign this thing. So you need to shut up and sign it and do it. You need to follow along with the program. You don't get to be like, well, the state is wrong. Yeah, you can't do that. Like you're a medical,
Everyone else
you
is
work
wrong.
for the state.
Everyone
You
else
work
is
for the
wrong
state.
except for him.
Mm-hmm. This is unbelievable. This is just unbelievable.
Understanding of the nuances in
nuance. He used the word nuance.
Practice medicine versus
why is that
folks who are
jumping? That was
non-medical.
weird.
And so to come up with a statement like this, it's really not an advisable thing by our legal department to sign. So I'm going to follow their advice. But like I stated, it doesn't change my diagnosis. It doesn't change my testimony, whether or not I sign this document that kind of overstates.
Then sign it. Then
what
just
we're
sign it
able
if it
to
doesn't change
actually,
anything.
Now he's going to say
because-
it overstates what we're able to obtain. This is bullshit.
Like say if this patient, say if Jameson went to somewhere outside of children's, went to an urgent care somewhere, we don't have access to that. I'm saying that I reviewed that when I wouldn't be able, you could then produce it later and say, you didn't see this document, yet you signed this attestation. So that's why I feel that our legal department is
So maybe you
concerned
should be
about.
more fucking thorough.
So that's why.
Yeah. Maybe you
we've
shouldn't
been
be a
advised
lazy
not to sign it, and I
investigator.
won't sign it right now.
Okay. And now, do you have any expertise in studying connective tissue disorders or the role of collagen in developing connective tissues?
Like, am I a collagen expert? No, I'm not.
Well, do you have any particular familiarity dealing with connective tissue disorders generally?
Yes.
Okay. What is the role of collagen in connective tissue production and creation?
So collagen is a protein that is incorporated into our body. You have this in the connective tissues and the bones. So it's pretty much like the structural backbone of those organs in our body.
And if I understood you correctly, would that have anything to do with the propensity to bruise or have blood vessels? I believe your phrasing was mush up around the area of an injury.
Mush
or
is the new
impact?
squunch.
No, so that would be more the elastin
Yeah.
that's in the blood vessels, because that's the protein that is more pliable than the collagen.
And your position is that someone could have potentially caused rib fractures.
Oh, Jennifer has to go because she has a phone call she has to make. So she won't be with us for the remainder of this program today. But Jen, thanks for being here.
Yeah, I'm
And,
just sitting here till it comes through, and then I'm gonna hop
all right,
off.
cool. But we will not be back here tomorrow. We'll be back doing trial coverage on Thursday. Who's next? I guess the defense's first witness. We'll be done with the state's case. So we'll do defense's first witness. Who is the defense's first witness?
The orthopedic surgeon.
All right. Well,
Nice.
on Thursday starts the defense's case. I can't wait for that. All right.
To Jameson by squeezing him, and it would have produced no bruising or internal
This is
organ
just a
injuries
stupid story.
on either the front or back half of his body.
Yes.
And your
like,
position,
yeah.
someone could have slammed
Yeah, totally.
Jameson down on a surface, and the
Hard
only
enough to
injury
break
it
a-
would have caused would be a loss of vertebral height in the T10 vertebrae and no other injuries.
No bruises.
I don't believe I testified that there would be no other injuries. I mean, I could imagine that you could get some soft tissue injuries like on the buttocks from where you like impacted into
Yeah,
the
you would think if it was
into
hard
the
enough to break
surface.
your spine.
Potentially. Believe my testimony was that there would not necessarily be any.
All right, fake words. Mush up. Mush up is not a medical term. We're putting that in the fake word category.
Internal organ injuries. So like to the pancreas, which I explained, you would need to have, blunt force trauma to the abdomen to actually compress or squish that pancreas, or to the liver, to the spleen.
He really likes acting things out.
That's accurate.
Okay. And when do you think Jameson received these injuries?
Which ones?
Any of them?
So the rib fractures were already in the healing stage. when they were first imaged at Children's, which was on all right, so the first skeletal survey was on January 14th, 2022, and those were already healing. So those would have been older. Those would have been, like I mentioned earlier, at least 7 to 10, 14 days or older. They could be weeks old. We know that
How old
there
is
was
the
a
baby?
skeletal survey on November 18th of 21. And again,
The indictment and the arrest warrant stated that we did them between January 10th and January 12th. Images were taken on January 14th.
Right. And the investigator said that. And then when they asked him, where'd you get those dates? He was like, well, I pulled them out of my ass, basically. So, I mean, how are they determining when he got these injuries? Nobody knows.
another normal skeletal survey on December 8th of 21. Those were at Erlanger. So there's no fractures in that time period. So it would have been after that. The abrasion on the face.
God, he's
would
got
be
to
recent.
act
It's
out
still
everything,
healing. It hasn't
everything.
completely healed.
Including the mouth stuff. Like
if he had some collagen disorder, I would expect that, potentially get some changes to the skin there as it's healing, which I didn't detect on my exam.
Because it was.
That would have been.
What?
He said it was healed, completely healed on his exam. When was his exam? Like in February 3rd?
February 3rd.
Yeah.
I'm twitching. My face is twitching. I've already I ate a bowl of spaghetti because I was stress eating. That's why I was gone from my camera. I have to get new Oreos now because they're all gone. My face is twitching.
Wait, Carrie's face starts twitching is going on the next bingo card. Carrie face twitch. That's funny. You poor thing.
Closer in time to when that examination occurred, when Dr. Brown saw him. Same thing with the injury inside the mouth. The thoracic injury that was healing on that initial skeletal survey at Children's was not seen on those prior two. So again, older at the time of that 114 skeletal survey. So it's in two different time frames where we have this more recent injuries inside the mouth and on the cheek, and then the older healing injuries to the ribs and to the vertebral body.
Okay, so again, is there a time?
It's like
estimate
he's playing charades.
Like
what? Like if we just watched that without the sound, could we guess what he was talking about?
I mean, I could
probably.
He's all over the place. Come on.
It's like he's playing charades with the face touching. And he's like, 2 words.
Glasses
Two
on,
syllables.
glasses off, glasses
Glasses on, glasses off. 1, 2, 3.
This
4.
dude.
This. Yeah. Look at
happy hands. And then we we wash our
Wait,
face.
we're
And then we brush our
face.
teeth. Oh, and then we do a happy dance
And we-
because we did the things.
It's almost like this weird. It's almost like sign language, but not sign
Is there
language.
a time estimate you can say? Like when this would have happened? And if the answer is no,
I get flashbacks to
what you
the
did-
real quick. I get flashbacks to these aren't jazz hands. These are jazz hands. That's what I'm getting flashbacks to right now.
And us is all you can give us then.
Wait.
And if the answer
This is
no,
important.
you can. So again, is there a time estimate you can say? Like when this would have happened? And if the answer is no, or if that what you've given us is all you can give us, then I don't want to.
So yeah, and I'm not going to overstate things. We are limited by how the body heals, right? So I can't tell you, as I mentioned earlier, like that it happened on, June 5th at 3 p.m. in the living room. That is not something that we can possibly state.
That's what Faulkner
But
did.
I can tell you if
I know where it happened. It happened on whatever day you took him to that pediatrician in the examination room with the popsicle stick, and it was Miss Harbin Picket. That's who did it. Miss Harbin Picket in the exam room with the popsicle stick.
Yes.
Just saying.
things are older and healing versus more recent.
I can play Clue too,
healing that was
doctor.
on the mouth and on the cheek versus not present at all, which we saw on those initial x-rays. So we know that this is outside of the realm of birth trauma based on the absence of any kind of fractures that were detected on those first two skeletal surveys. Then they were already healing.
I've got inner songs on a playlist too, so I get the
114
dancing.
Skeletal survey. And then if you recall,
That's what he's doing. He's
on
just
2/3/22, the ribs had already healed completely.
Vogue.
And then we just saw the continued healing of the vertebral fracture. Then there was a fifth skeletal survey that was done on June 16th, 2022, after he had become much more mobile, crawling,
Jesus,
going
with
to a
this dude.
stand, and that didn't show any skeletal injuries at all.
I'm gonna see how annoying it is to take my glasses on and off as much as he
I guess I'll
does.
take that
Head,
then. I
shoulders,
believe those
knees,
are all
and
my
toes,
questions for
knees
now,
and
Doctor,
toes.
and thank you for your time.
Shoulders, knees, and toes.
Thank you, Ms. Bernard.
Knees
Ms.
and
Fox, any
toes.
questions on redirect?
All right, this is so great.
It's the end, damn.
This is so great. Pay attention, folks.
Dr. Messner, is it consistent or inconsistent that the rib fractures occurred between November the 21st of 2021 and January the 3rd of 2022?
Objection.
Consistent or
Wait,
inconsistent?
just a minute. Let me hear the objection.
I gave him literally every chance to specify the time frame. He could not and would not answer it. I believe that is a leading question from the prosecutor at this time, where she is specifically indicating the date range she wants him to answer.
Yep.
Ms. Fox?
Your Honor, my question is
100%.
consistent or inconsistent, so it's absolutely
But you just
not
gave him a
leading.
date
The
range.
date range I have
dumbass.
suggested is within the answers that he gave her, and I'm allowed on redirect to cover the topics she covered on her cross. That's the evidence rules.
And Your Honor, I would argue that the witness has had the opportunity multiple times to answer that specific question. He has declined to provide the answer that is
He doesn't get to
contained
do it
within
now.
the question Ms. Fox is asking. And so I would again raise the objection that it is.
And the
I'll
jury's here
sustain
for
the
this,
objection.
right?
You can
Yep.
rephrase the question.
Sustained.
Smiling. He's smiling. Watch him smile. Watch him smile.
Okay, let's go back. Let's go back.
The answer that is contained within the question Ms. Fox is asking. And so I would again raise the objection that it is a leading.
I'll sustain the objection. You can rephrase the question.
And the eye roll.
And now,
Wow.
now the judge is asking her to rephrase the question, which I think was a mistake, and she'll correct herself in a minute. But because there is no way to rephrase the question, because she already led him to the answer she wants, right? So technically, this can't go forward anymore. Like you now have to just drop this, because there's no way to rephrase it where he doesn't still have that in his head, right? So this is great. Listen to both lawyers are going to jump in here. It's great. Jason Hood and Catherine are going to be like, whoa, 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 whoa. Oh, look at his face.
I'll break it into smaller parts. Dr. Messner, you were just cross-examined extensively on the time frame of the rib fracture injury. Is it a fair statement that your answer is it occurred after his visit to Erlanger?
Don't answer. I've got an objection.
I would object to that as a leading question as well.
It's certainly more leaning is it inconsistent or consistent? I can break it into smaller
You gave
parts,
him
but
a
that's the best I
date.
can do
Well,
that.
and I apologize. I forgot to ask Mr. Hood if he had anything to add on the last go round, but Mr. Hood.
A short leading question is just as leading as a long leading question.
Yep. Can we take a moment?
Yes, sir.
Can we take a moment for Mr.
Snaps.
Hood Can we snaps for Mr. Hood.
Snaps for Mr. Hood.
A short leading question is the same is as
He's
leading
no
as a long
nonsense.
leading question. I love that. A short
nonsense.
leading, Your Honor, a leading question is a leading question. Look at the judge's face. She loved that. She loved it. She's got the look of joy on her face. She was like, yeah.
Listen, I'm going to sustain the objection. You can't suggest the answer to him in the question.
That's
Dr.
right.
Messner, is it consistent or inconsistent?
You can't
that
just
occurred
ask the same
after
question.
The visit to Erlanger. That would be a choice that is not leading.
That's the exact same question.
Same question.
I maintain my objection.
Mr. Hood, I'm going to sustain that objection.
Your Honor, then I would
Yeah,
not
because you're
have any
asking if it's
redirect.
happening after November.
I am going to go ahead and we are going to mark off thug judge because this judge ain't letting this shit go.
I understand you're moving for a mistrial when you got additional time and you can call the same witnesses to address whatever issues. Is that what you're saying?
Yes, Your Honor, because we
Can I-
don't. Okay.
Can we go to exhibits, please?
This is a double guns moment. I am going to sustain this objection. Now sit down. Sit down. You're done. Oh.
Denied. I do accept, but appreciate your ruling.
I understand, Ms. Fox. Mr. Hood, any questions?
Sit down, bitch.
Good afternoon, Doctor.
Bitch, get out the way. Get out the way.
The genetic aspect of this, a couple more questions about that. Y'all send off the blood to be tested for genetic variants, correct?
That's correct.
So it's an important aspect. It's something that y'all want and need to know in terms of making a diagnosis, correct?
So
you don't send off the test for the heck of it, correct?
Correct. We send it off to evaluate.
Oh my God, wait. Rogue Mama is memeing.
Oh God. That's how I feel. That's how I feel. Yeah.
Did you
Yeah,
just
I'm
say
angry.
hi on this, or did she really make this face? Because I am dying right now. Flux is gonna get angry. You know what? That is going on the bingo card. That is going on the bingo
I like
card.
it.
Instead of Flux is gonna get angry, this picture is gonna go there instead.
My tag under is geeks and gamers,
Gamers.
too. Oh yeah. I know. I love that so much.
I am dying.
Because you want to know the answer to the question, correct? Okay. And the answer to this question
There's
came back
more.
with a variant of unknown significance that we talked about ad nauseum prior, correct?
It did have a variant of uncertain significance, yes.
Okay, so I'm going to pose a hypothetical question to you. If you were to find out a week, a month, 6 months, a year, 18 months, 2 years from now, that this variant was no longer classified as a VUS, but instead was now classified as pathogenic, would that change your opinion about this case?
He's gonna say no.
And that
I know.
Answer the hypothetical, please, and then you can give your explanation if you want to.
in this particular case, no.
Oh my God. Get the
No test result in
out.
that realm will change you or CHOA's diagnosis about this case.
No, that's not what I'm stating.
Yes, you are. Well, okay. What would it take then for it to change
Explain
your
your
mind?
answer.
What would it take?
Sure. So this variant of unknown significance was identified in just one patient at the time, which is Jameson. And we know that he did not have any additional fractures in that time period. It was also identified in 2 others since then.
I hate him.
When I reached out to the laboratory at the University of Washington to find out, hey, has there been any new evidence that this variant is causing problems to people? They said that they had identified it. It had been recorded in 2 other individuals. And to their knowledge, it was not pathogenic, that they were not experiencing increased fracture. They also said to me that they give it a
Judge,
Splice AI score.
Wait just a minute. Wait a minute.
Delving way into 2 or 3 layers of hearsay, I think. So it's non-responsive and I would object.
Ms. Fox?
He asked him to explain his answer. I have no additional statement.
Well, I would say this. You are entitled to explain your answer, but you can't tell what other people said to you. You can tell what you did, but not what somebody told you.
What I did was I reached out and I learned that the likelihood of this particular variant is so incredibly low on the when you look on the AI splicing that it's considered likely benign. But when you look at the individuals, you have to look at the patient, right? So you have to look at how is he doing, and he hasn't had any additional fractures. So to say that there's something inherently wrong, this is not.
Oh, Carrie's dad's smoker's cough. I couldn't identify it yesterday without you, so I didn't know who's.
I know that from 10 miles away, man.
Oh, I got 2 bingos. I got double bingo with that one. Excellent. I'm doing much better today.
He says you have to look at the child, and I would just like to insert the photo I just sent you with the markings and the lines all over.
Right.
You got to look at the child. There he is.
Yeah. And he couldn't even remember those photos. He didn't take them into consideration, nothing.
And the area where you even are changing the codon. I stand by my testimony earlier that no, it's my testimony that I do not believe, and that's based on my experience from my
I knew this one was coming.
Research on this, and from my knowledge that he has not.
Although I get it, it does make me feel smarter to hold my glasses and shake them at you.
I'm asking you to.
It does make me feel smarter.
That research in the future determines that the variant is pathogenic. Is it your testimony that does not change your opinion about this case? Don't change the hypothetical.
Don't
I'm not going to
change the hypothetical.
But you have to look at how is it expressed in that patient. So you can't just take it and say, oh, this is, pathogenic.
No, so what he's saying is he is determined to be the God over all these cases and say, no, if I don't see what I need to see, which is textbook, these things. So if you happen to be out of the realm of textbook, right? Because each person is an individual and maybe you're not a textbook person, but according to him, if it's not textbook, what he was taught that he should see, he's calling it abuse. This guy should be fired. Yeah. He should lose his medical license because he's telling you the truth right now. This is the way that he's not lying just for this case's sake. He's telling you the truth. If he doesn't see it, it's not going in the record. He doesn't care if it's pathogenic. This guy does take his license. Shoot, I took off take his badge because I was like, there's no cop here. I should have left it on because we could have done that. Take his.
Well, they all think they're cops. I'm sorry, but child abuse is not a diagnosis. It's an accusation.
Right. You're also correct about that. It is not a diagnosis. It is an accusation. 100%.
Not expressing that. So in this case, if in the future, we are still seeing that there are no additional fractures, there are no other signs of OI, and somehow they've changed the categorization of this variant. In Jameson, if it's not causing fractures, then no, that doesn't change my opinion because it's
How do you
that is
know
not the
it's
causative
not?
agent.
But your analysis assumes, does it not, that the causative agent is non-accidental trauma. Whereas if there's a pathogenic variant at the collagen-producing site, that could explain every injury that's occurred in this case, could it not?
This will get awkward.
Hypothetically, Jameson had OI. I would not expect him to have rib fractures.
What?
In the first year of life, that's
Wait, whoa,
exceedingly rare.
whoa. OI, osteogenesis
changing that-
imperfecta, is what they used to call brittle bone disease. Am I wrong? It's brittle bone, right? That's what it is.
so.
Yes.
Yeah.
The very like symptoms of it are broken bones, are fractures. It is not very rare in the first year of life. They would actually, that's what happens. Stop it. This guy is the C word. Luckily, Carrie dropped it ages ago. So
I didn't. I said see you next Tuesday.
She did. She didn't actually say the word, but we're counting it because it was funny and because she's probably going to go to confession later.
And patients who have OI.
I'm just kidding.
I would expect that his long bones would start bowing when he starts bearing weight. I would expect for him to have increased fracture as he becomes more mobile and he's, bumping into things. So no, I don't think that would explain the totality of his injuries. I would expect to see additional changes on the skeleton. I would expect to see, like I mentioned multiple times, the genetic makeup of your body, it's not going to change. So you're going to see this occurring as you get older. So that's my answer.
Oh,
All right. Thank you, doctor.
got something.
Yeah. Yeah.
So I just happened to use my fun chat GPT and some AI. So collagen, which we've never said he has OI. Okay, that was brought up basically by the state. We do know that he has a collagen issue because of the genetic testing. So qualitative defects or abnormal collagen being made can lead to fractures in utero at birth or frequently in the first year of life. But that is seen in OI types 2, 3, and 5, moderate to severe forms. So if that ever came back, hypothetically, as the question states, as pathogenic, there's your answer.
He's wrong. He's just wrong. It's just wrong.
I trust
He's a
AI better than
dumbass.
this guy.
Unbelievable. Absolutely terrible. Absolutely
Wow.
terrible. Well, we have finished his testimony for the day. I have double bingo. How about you, Flux? How's your bingo card?
I don't even think I got one bingo.
That was me
Oh, wait, no,
yesterday.
I did.
You did?
With
Okay,
the
good.
judges were their break. That was the last one I needed for a bingo.
Perfect.
Yeah.
All right. Well, we are almost finished. We have a super chat by Puzzled Puzzler. Thanks for the 2. Says maybe he's playing head, shoulders, knees, and toes. Yes, it's possible. The hand motions. I am going to say I'm very glad that we are done with Dr. Messner. I don't think I could have handled another day of this. Thank goodness that we did it in 2 sessions and not 3, because I don't think I could take him for another day. This man, in my opinion, after watching this, especially after that last line of questioning, needs to lose his medical license. He should not have one. This guy is a dangerous person. He doesn't know what he's talking about, and yet he has so much power over the lives of families. Yeah, no, State of Georgia needs to investigate why he has a medical license. He needs to take the test again. Disgusting. Absolutely disgusting. He should be under investigation. Yeah, for sure. So tomorrow I will be here in the morning doing Laura Owens updates, and hopefully Dave Neal will be with me. We're going to read through some new documentation that came through, some new filings, And also, I'm going to hype up my Give, Send, Go for my trip to San Francisco because it's almost funded, not quite all the way there, and I need to pay for my hotel. So we're going to be doing that tomorrow, and I will be back on Thursday to start the defense's case in the Timms case. That's going to be great. I can't wait. I've been waiting for the state's case to be done. I can't wait for the prosecution to really make asses out of themselves in the cross-examination phase because I'm sure they will. And so that will be on Thursday. Also on Thursday, we're probably going to start right at 9 and go, and I can't go past 11:30. So it'll be a little bit of a shorter day on Thursday, but still it'll be good. So everybody take care. Thank you so much for being here. Carrie, thank you for being here. Guys, don't forget to visit that fundraiser. The fundraiser, let's check on it. It is at 58%. 58%. We're at 5,100. You guys, we started out today at 4,100. Started out at around 4,100, and it's gone over 1,000 now. It's over 1,000 because of just today raised. Unbelievable.
Thank you. And now I have to go get some more Oreos, so that's going to help me get a new thing of Oreos for stress eating. Thank you.
For sure.
Oh,
so I will
man.
see you ladies on Thursday. Take care, everybody.
I was lost, my world is near its end. I almost felt my head is full of a million choices. I am alive, I'm not here to pretend. I love my friends, my heart is filled with a million voices. Oh, this road has many choices. Oh, and my heart, million voices. Come next to me, my friend, embrace the sky. I'm not afraid to fly. It's not the time to say goodbye. I don't wanna say goodbye. No, I don't wanna say. No, I don't wanna say goodbye. No, I don't wanna say goodbye. This time I know my road is near its end. I almost felt my head is full of a million choices. I am alive, I'm not here to pretend. I love my friends, my heart is filled with a million voices. Oh, this road has many choices. And my heart, million voices. Come next to me, my friend, embrace the sky. I'm not afraid to fly. It's not the time to say goodbye. I don't wanna say goodbye. No, I don't wanna say. No, I don't wanna say goodbye. No, I don't wanna say goodbye.
So I take it that
Johnny's
you've
problem
seen
is he
Cameron
should have
John's
come
bedroom
storming
before.
in there with
Yeah.
a string of
Do you
garlic
recall when
and
we
some
went
holy
into
water.
Mr. Judson's
Across
first
the
bedroom?
crucifix one.
May the
Do you
power of
recall,
Christ
or no,
compel you.
No, I don't.
You
So
realized
Miss
his house
Heather,
was infested with
just up for
succubuses.
that,
And
there's a picture I'll share with you of what it, yes. Do you recall while that was there
Succuloters.
when you arrived in the afternoon? I don't remember seeing it now. So while she
No wonder he said drown her before you burn her.
Oh my god.
All
You-
right.
Your next witness?
Now I know
Witness
why
for
he wanted to
unknown
drown
use
her.
of laces.
Next
is
witness
also
lives in
by
Romania.
video.
Is that correct?
That depends on his